You're live.
Welcome to the Newington Town Council regular meeting of Tuesday, February 28th, 2023. I'd like to call the meeting to order at 7:03 p.m. Please join me in the Pledge of Allegiance if you're able. I pledge
Allegiance to the flag
of the United States
of America,
and to the
to the
republic
for which it stands,
one
one
nation,
nation,
under God,
under
indivisible, with liberty and justice for all.
for all.
Thank you, everyone. We'll move on now to roll call, please.
Counselor Annis.
Here.
Deputy Mayor Budraco.
Here.
Counselor Camillo.
Here.
Counselor Donahue.
Here.
Counselor Mankey.
Here.
Counselor Nagel.
Here.
Counselor Page.
Here.
Counselor Rada.
Here.
Mayor Del Buono.
Here. Thank you.
Before we move forward, I'd actually just ask that the council take a moment of silence for the upcoming 25th anniversary of the lottery shooting. That'll take place on March the 6th, so we won't meet before that.
Thank you for bringing that to our attention. We'll observe a moment of silence for the, say it again, the
25th anniversary of the lottery shooting.
anniversary of the lottery shooting. Thank you. Thank you. That is a day that you don't forget. If you live in Newington, you don't forget where you were, when you heard it. Definitely, it's still right there. As soon as you said it, it's right there.
First day on the final.
We'll move on now to approval of the agenda. Counselor Mankey.
I have one change I'd like to propose. I'd like to add under 11D, lease document authorization for the fire truck insurance.
Adding D fire truck lease. Any other changes? Counselor Page?
Thank you, Mayor. I'm just going to ask the council's patience just for a second while I try to explain this. If I understand what I'm saying clearly enough and help it be understandable to the rest of you, I would ask respectfully that we table until next meeting, item 8A. My rationale is, and I know I've addressed this to our interim town manager briefly, and I think the response was, and it probably is right, but I'm feeling compelled to just clarify it, maybe even with a legal rendering from our town attorney, that the answer is it's under the charter section to appointments. And my question is, we're preparing to assign counselors to be liaisons and members of various boards and commissions tonight. And according to sort of the history of the council, that's usually thought of as a pretty perfunctory pedestrian kind of thing. We do it and then we just get on with business, not a big deal. My concern is, as I've not had to do that other than when it first happened, when we were first elected, and it sort of happened, and I didn't remember all the details. As I've now deliberated over this more thoroughly, and I've looked at our charter and I've looked at the definitions of different offices, whether they be liaison or they be committee members and so forth, I was challenged, which isn't unusual, John, I'll say it before you do, there you go. I was challenged to figure out how the charter supports the appointment by this body, whether they be liaison members or they be full committee members. The only thing I could discern in my read over and over of the charter was that the Youth Adult Council is specifically mentioned, as is the the Environmental Quality Commission, and there may be others that I'm missing, but I went through using the words liaison and appointment. And so I would just ask, can we just move this to next time so that we can clarify it? And it may be just an episode of Let's School Mitch Page, so he's less ignorant about the policies and procedures around charter application. But thank you, Mayor. That was my request.
All right, thank you. They are your appointments, so if you're requesting them be tabled, I have no
Okay,
problem with that personally.
Yeah. And if we could just get a clearer answer on that.
Yeah, I don't know about charter. I think the boards and commissions booklet speaks to board and commission appointments. I don't know about liaison specifically. I'd have to look at it. It's in the
Okay.
office.
Liaisons are usually called out in the creating ordinance or resolution.
Say that again. I'm sorry.
When you're setting up your boards or your commission, depending on how you set it up, either by ordinance or by resolution, you'll usually call out whether you're going to have a liaison or a full member appointment to that board or commission. So it'll depend each one of them. This list is one we've kept over the years based upon liaisons that have been added over time. So TPZ, we have a liaison to the library board, we have liaisons to Youth Adult Council, Human Rights Commission. All of them have specific representation, so the individuals are able to report back to the council.
And my only question, just, and I'll stop, is just if I could get clarification, please, on by what authority in the charter gives this body a place to approve or not of certain liaison offices, whereas the language on other bodies is clearer to me, I think, much clearer, at least to the two that I've mentioned. And some of that is clarified in the language, not so much under appointments as it is under the respective summary description of the duties of that commission or board. And so I just would ask for that to happen. So.
You have something to add to that?
I do.
Okay.
I
There is
just-
another hand up, but I think it's a change.
I have no objection to tabling. I just want to let you know that our caucus has no intent to stop any of these appointments. We have no
Correct.
objection
No,
to
I
anything.
appreciate that.
I just want to be on the record that we have no objection to any of the appointments.
All right, so we have the change to add 11D fire truck lease. We are going to be voting on taking, tabling item 8A, so taking that out. And then Councilor Camilla, your hand is up as well.
I have a change for 11C, like to table that. That is not how I wanted it worded, and we'll bring it back another time.
So removing item 11C, discussion of zero increase budget plan. Okay. Thank you. So we have 3 changes before us. Is everyone comfortable with voting on these as one?
I think so.
All right, so I'll entertain a second.
Second.
Second, but you can't second.
No, I
You
can't
already-
second. I made a
Second by
change. I'm
Councilor
sorry.
Donahue.
You're
Any
right.
other discussion on these 3 changes? Hearing none, all those in favor signify by saying aye.
Aye.
Any opposed? Motion passes unanimously, and we have our new agenda. Thank you. All right, next item this evening is presentations, and we have with us this evening our folks from the Central Connecticut Health District for their annual update. Charles, I'll introduce you first, and then if you could introduce the rest of the folks with you. We have Charles Brown with us this evening. And councilors, you should have your packet on your desk. There was a packet provided to us. See there? Okay.
So thank you, Madam Mayor. I'd just like to introduce our representatives and our board chair from the Central Connecticut Health District, Barbara Gilbert, who is our board chair, representative from Rocky Hill. We have on the Zoom call, Roy Zatarian, Kevin Borup, and I believe they're live in the town council. We have Geraldine Nagel. We have one other representative from Newington, Dave Woodmatt, who may join us at some time. I'm going to take over the screen now to start the presentation. Okay. So as you said, this is our annual presentation for the 2022-23. Basically, my name is Charles Brown. I'm the health director for the Central Connecticut Health District. Barbara Gilbert is our chairman for the Board of Health. General information about CCHD: we are the local health department for the towns of Berlin, Newington, Rocky Hill, and Wethersfield, serving a combined population of about 97,000. We were founded in 1996. We've had over 25 years of service now, providing a broad range of public health services to all of our member towns. And we'll be going over a few of those to be able to let folks know exactly kind of what we do. General information, we're one of 20 regional public health departments in Connecticut. So the light blue in the area are towns that are covered under district departments of health like ours. We're right here in the middle, number 3. The yellow are actually full-time municipal health departments. And then you see speckled in white what they have part-time health departments here in the state of Connecticut. Our central office is here in Rocky Hill at 2080 Silestein Highway. We have 14 full-time employees now, and that includes 3 COVID-19 grant-funded positions that we've added within the last couple of years. We also have over 50 active professional and lay volunteers. As I mentioned, we have our 14-member Board of Health that's made up of board members appointed by each of the member towns, and this is based upon population. Newington has 4 board members, and all the rest of our towns, the other 3, have 3 board members. Basic organization chart, just wanted to show this because we have changed a little bit since the last time that I was able to present to you guys. We have me at the top here in the purple, our administrative services, environmental health in green, and then our community health division. And we now have a clinical health services division that we've set up through some funding from the state that's going to be actually doing COVID testing starting up here, hopefully here in the next several weeks. So exciting to be expanding out into clinical services as we move forward. Bottom line for how we fund the agency overall. So just got done with our audit. So we were able to report on our revenues from 2021 and 22. Town contributions at $7 per capita, so $7 per person per year helps from the towns, helps to pay for all the services that we provide. In addition to that, we get about another $565,000 in grant revenue from federal, state, and other agencies. And we actually raise program revenue through fees that we charge for licensures, for services that we provide through insurance billing for flu vaccinations and other things. And then we get a little bit of money from interest. Our expenditures, as you may figure, we don't make widgets. So most of our expenditures really go towards the salaries and benefits of our professionals that actually are out there doing the job in public health, with some money going to contracts and about $175,176 for our program and operating expenditures. Just to kind of give you an idea as a difference, because everybody can kind of wrap their head around what healthcare, because we kind of experience that individually, but public health is similar but a little bit different. So the primary focus of healthcare is the individual. Public health really looks at the population as a whole, as you know, who we care for. Interventions in healthcare really start with diagnosis and treatment of that individual, where in public health, we look to assess the situation, develop policy, and assure that the policies are followed as our interventions. The process in healthcare really looks at management of patient care, where public health looks at systems management, looking at the environment and human behavior and how it affects the health of the community. The outcome for healthcare after you're sick is ultimately to return that individual to health, where in public health, we look for the healthy community as a whole. So I'll go over a lot of this as far as the purpose of a public health agency. Really to kind of encapsulate it, a lot of it is to prevent, promote, and protect. We prevent epidemics, we protect against environmental hazards, we promote and encourage healthy behaviors, and we really look to assure the quality and accessibility of health services. And wouldn't it be great if we could walk into a pharmacy and ask for an ounce of prevention? You know, that would be ideal in my world. So let's start with the elephant in the room. COVID-19 data as of February 24th in Newington had about 8,067 cases, confirmed cases of COVID since the beginning of the pandemic, 154 fatalities, and the number of tests that we'd conducted in Newington, about 14,207. Vaccinations in Newington really look good for those over 11. So, you know, you've got a lot of folks in your elderly that have been vaccinated. You really have done a great job since the beginning of the vaccination efforts. We really need to continue to push for those younger folks to be protected through vaccinations. The numbers there are a little low. So we want to make sure that we're encouraging folks, especially through the school systems, to get vaccinated and protected for everybody's benefit. So overall COVID since October, we've seen kind of a rise and fall. So as we were concerned about over the holidays and Thanksgiving and Christmas and New Year's, we saw a general rise in the number of COVID cases throughout the district. And now we're starting to see what we hope is kind of that seasonal pattern that we see with influenza and some of the other respiratory diseases, to where we see it in the fall and the winter, and then towards the spring it kind of tapers off, and then summer, and then picks back up here in the fall once again. So numbers are heading in the right direction. I encourage everybody to continue to do the right things to be able to keep them moving. So all those prevention steps like washing your hands, covering your cough, staying home if you're sick, and getting vaccinated and wearing a mask where it's appropriate. So we still are conducting COVID-19 response activities. Part of these consists of vaccinating vulnerable populations, including adults with functional needs and the homebound. We daily work on tracking cases within each member town, and we now have an epidemiologist that helps to assist with that. We continue to work with case investigators, meet with them every day, and they're actually calling confirmed cases to make sure that they understand and have the resources to be able to do the right thing as far as isolation and quarantine if they are sick with COVID. A lot of health education goes into that, so people understand and know the reason why they should be doing the right thing. We provide technical supports to schools and daycares on their planning efforts. We're the subject matter experts for the press. We also provide regional support to other local health departments if they need it. And here recently, we've been distributing a lot of test kits, especially here outside of our office, but we've been distributing them to each one of the towns to assure that when somebody feels a little sick, or that they're testing appropriately and then are able to isolate and quarantine if they do test positive. Other things that we do preventing epidemics and the spread of disease, as I mentioned, influenza, one of the things we do in the fall is do mass vaccination clinics in each of our towns, Newington and all of them. So last year we did over 1,200 flu shots, and the average time that we see from somebody walks in, they've got their paperwork done, is about 3 minutes. In addition to influenza, we also do disease follow-up for other diseases like hepatitis A, B, and C, salmonella. We follow up on lead poisoning in children. We also look at vaccine preventable diseases like measles and whooping cough, and follow up on things like Legionella. There's a list of reportable diseases, and we're continuing to follow up on those. So I mentioned influenza and RSV. We did see a big spike in influenza here around November, December. And luckily that influenza curve, that peak in that epidemic has gone down quite a bit. So hopefully we're done with influenza for the season. I encourage everybody to just continue to do the right thing to be able to limit the spread of those respiratory diseases. Other things that we do to limit the spread of disease from other vectors are things like looking at mosquito and tick-borne diseases like Eastern equine encephalitis, West Nile virus, Zika, Lyme disease, which we're all very familiar with, but then some other tick-borne diseases like ehrlichiosis and babesiosis. And this is where we actually have the advantage of actually having an epidemiologist, and this helps me tremendously. It's not just because I have good colored graphs to be able to show you, but there's a lot of meaning there. So having somebody focused on the data really gives us some opportunity to help prevent disease in the future. So as you can look here at this graph, you see kind of the rise and fall of the blue, and that's the temperatures going from summer to winter, summer to winter, summer to winter, and all the valleys here are the winters. Where you see that blue line be a little bit higher, that means the temperatures really didn't get all that cold. And with ticks, it makes a lot of difference, because without a really good cold winter, the numbers of ticks in the following summer goes up. So you can see among the green lines, that's Lyme disease, and we kind of see that every year. But in the years where we actually have a higher temperature during the winter, we start to see things like babesiosis. And then here last winter, where we had a high temperature, we see babesiosis and ehrlichiosis actually start to crop up. Reasons for that may be because we're actually seeing different types of ticks that transmit that disease that weren't really in the population, in the environment, that can survive now at higher temperatures. So we need to watch that as we're looking here next winter. because or this coming spring, actually, because we're actually seeing a very warm winter this year. So we anticipate that we're going to see more ticks, more exposure. So people need to really do the things to protect themselves from those interactions. We also do a lot of responses to through the opioid crisis. We continue to be the convener of local response agencies in our towns. We have a opioid coalition that we're working with all of the social services, and we have work groups that address prevention, response, and recovery. We've just been awarded our grant renewal from the Department of Mental Health and Addiction Services to work with persons suffering from addiction and their families. We've got a recovery coach that works in our district, primarily along the Berlin Turnpike, really trying to reach those people who are struggling with substance use issues. Other things as far as foundational services, we do protection against environmental hazards. Our environmental services did close to 1,000 food service inspections last year, 39 septic, 74 pool, 43 motels, and 41 salon inspections. And that's an awful lot of inspections out there. They do out there every single day. You may have seen in the Current that we recently had an article about some failed inspections, but our folks are out there all the time. And a failed inspection is really an opportunity to be able to correct things. So it's not necessarily a bad thing. We look at it as an opportunity to educate, to assure that those conditions don't exist in the future. Other things that we do is responding to a lot of complaints. The majority of complaints that we deal with are housing and property maintenance issues, but we also have other food related things, rodent, insects, garbage, refuse, air, water pollution, and actually complaints within the motels, which we also regulate. We also have our Putting on Airs program, which is an asthma program where we conduct home visits with asthma patients and their family, take a team approach that really highlights the triggers in the environment by actually going into the homes and actually seeing where there's some opportunities to make changes to limit the triggers for asthma and educate families on the proper use of medication. Many folks with asthma may see a doctor and not have all the information that they need in order to manage their asthma effectively, especially children. So this educational component really does help to make a difference in limiting the number of emergency room visits as they go forward. In addition to that, we have radon kits that we distribute, and we also do lead poisoning prevention, a lot of outreach and education around that. And that's going to be important because the amount of lead in a child's blood, the limit actually just went down this past year. So we're expecting the number of lead cases that we actually see to go up as a result of that. On the positive things, promoting and encouraging healthy behaviors. We have our 4-town walking competition. And for you guys in Newington, I'm going to challenge you once again. Rocky Hill won the overall competition and the Impact Award for the highest participation in 2022. So Barbara Gilbert, who's from Rocky Hill, is excited about that. But you guys, I know y'all do a great every year. We want to really push coming up this May, where we have a Walk This May walking competition to really get folks out there, get them active, because it's really a proactive way to help healthy communities involved. We also have our emergency preparedness planning, where we respond to disasters and assist our communities in recovery. As I mentioned, our flu clinics, we actually use those as drills for medical countermeasure dispensing. We use those to test our plans. And I want to say thank you especially to Newington, because Newington CERT team helps support all of our clinics that we do. And we really could not do this without them. They have been, really, really helpful to us to assure that these things run as well as they possibly can. So we really want to thank Newington CERT team and the town of Newington for their support across the board. So as we look to the future, there are some things that we've been talking about for a few years that have actually come to pass. On February 16th, the state regulation to adopt the FDA food code actually went through. So we are now able to enforce the FDA model food code as the code here within the state of Connecticut. Now, the change in that is the fact that we're not going to really be looking as much at the halls and the walls and things like that. Of course, we're gonna pay attention to that, but we're going to focus on how people handle food, what they're doing as processes. that it's much more important that someone is washing their hands appropriately and handling the food appropriately. So that paradigm shift is really going to be less on the surroundings and more on the actions that people take when they're preparing food. In addition to that, we actually updated our sanitary code here last year, and that was adopted by our Board of Health. We're in the midst of our community health assessment and improvement planning, and I want to thank everyone that responded to the survey that we put out. That information about health perceptions in the community and what priorities people really wanted to see us focus on was very helpful as we move forward into our improvement planning for overall health improvement plan. Last two words, and I'll get off and answer some questions, is thank you. Thank you to all of our member towns, to the public, for your continued support for the health district and for the services that we do. We are very proud to be your local health department. And with that, I stand ready to answer questions.
Thank you, Charles, very much. I think I say this every year. I enjoy your annual update because I think each and every year I hear something more that you're doing that I didn't realize you were doing for us. And when we talk about our best bang for our buck, I'll tell you, your agency does an amazing job for the town of Newington in all that you cover. I wanted to ask you, the COVID grant positions, you said you have 3 folks that are funded under COVID grants. Are those grants that will expire, and how's that gonna affect you guys?
They are grants. They'll continue for the next couple of years, but they are grants that support our epidemiologist, our public health nurse, and our health educator. So as you've seen from some of the slides that we have here today and some of the services that we're able to provide, like homebound vaccination, we really value the services of having those folks here. So even when the grants run out, we're going to be looking to continue those positions as we move forward. It's a foundational service that they provide to a health department, to have somebody who's focused on the health data and is able to really take that data and operationalize it to interventions.
Yeah, and the reason I ask that is I think that's a general theme around the state and many agencies and municipalities is all the grant money is wonderful, but now we've got some folks being funded by that, and how do we now handle that moving forward in terms of keeping or not keeping those folks and funding for those if we want to keep and that kind of thing. So I was curious how that was going to work.
Yeah, and you know, the good news is that some of those positions actually help us to generate revenue. For example, the nurse that we have providing vaccinations does provide us with some opportunities to bill for those services. In addition to things like tuberculosis follow-up, we've actually made a few $1,000s here in the last couple months just from following up on daily therapy for TB, active TB cases. So, you know, it is something that, you know, those positions, while they do cost and they're funded by the grants, some of them we can actually look as revenue generating as we move to the future.
That's great. Yeah. And then one more thing, I just wanted to, well, maybe 2 more things. I enjoy the asthma education as someone who suffers from asthma myself, and so many of the students that I work with really struggle with it. And I think the education piece is really so important in making sure that especially our kiddos are getting the right treatment and and even knowing about the environmental impact of certain things on asthma and all of the education that you do. I think that's tremendously important. And I appreciate that on a personal level. And you'll be happy to know I went for my lung PFT test yesterday, so I'm staying up on mine. And thank you for mentioning our CERT team, because we are so incredibly proud of our CERT team in Newington. They're so strong and wonderful, and a huge group of volunteers that have helped so many towns, not just Newington. So I'm glad that you mentioned the impact that they've had for you as well. Thank you. I have a couple other hands up. Counselor Page first.
Thank you, Mayor. Just a few questions, Mr. Brown. First of all, thank you so much for your presentation, all the work that all of you do. I'm scared, and I think maybe many of us are, about the potential for serious ticks this coming summer, because I felt like it's 50 degrees every day, other than 1 or 2. Is there any advice y'all can give us as a community, and maybe more will be forthcoming as we approach the spring and summer, as to how we can prepare for ourselves, our families, our pets, and so forth? It's going to be bad, isn't it?
Yeah, we anticipate that there's going to be a lot of opportunities to encounter ticks in your environment. So there are a lot of things that you can do as homeowners and just as individuals as you go out into the outdoors to be able to limit your potential for actually getting bit by a tick. We're actually planning on actually doing a seminar working with the Connecticut Agricultural Extension Service to talk about tick-borne diseases and prevention. So more information coming up about that. Really, this is, I think, one of the examples that I can use that really shows that having an epidemiologist and being able to look at that data really does point us to the need for more education. So assuring that you're doing tick checks when you're out there, in the woods, assuring that you're checking your animals, your pets as they come back in from being outside, and then proper lawn care. Making sure that your yard is properly maintained, that you don't have a lot of tall grass, because that does actually help ticks. Ticks use that as opportunities to catch a ride as people are walking through. But we will, once we get the seminar and everything set up, hopefully here in the near future, we'll be getting information out to everybody.
Thank you so much. And I just have a couple other questions. One is, you made a brief comment about lead, and I know in some of our communities it's worse than in others. Could you just elaborate? I just wasn't sure what that was. There a problem or an issue with lead?
Well, they changed the actual statutory, the level to which we actually have to respond, what is considered to be a lead poisoning case. They brought that down significantly. So with that level being brought down, we're anticipating that we're going to see many more cases that we need to follow up on with respect to lead. So it's a bit of a double-edged sword. One, we're identifying people that have been, and especially children, that have been exposed to lead, and we're able to do an appropriate intervention after doing investigation. So that's a great thing, because we need to be able to catch that. There's really no amount of lead that we want to see in children, because it does affect their development. The opposite side of that is that it takes a lot of resources when you have additional cases, and the state made this change and didn't provide any additional resources for us.
No.
So yeah, I know, shocking.
Sitting down, right, Mitch?
Yeah. So we're really kind of holding our breath and hoping that we don't see, too much come in there, but, we're prepared. Our folks are lead certified as far as for interventions, and then having that additional staff with the nurse and the epidemiologist really does bring an extra component to be able to go on with those investigations and interventions.
And then the last question I had is, in some larger communities or cities, they will have restaurants with a letter grade based on their health evaluation. I'm not suggesting we do that. I'm just asking, what are the pros and cons on that? And has there been thought of that? Is there value in that? Or are we having such great compliance with our restaurants and so forth that we don't need to do that?
I wouldn't say that, there is value in that, because it's easy for people to actually interpret those grade letter type things. With the change to the FDA code, it's going to make it a little bit harder to make those grades, and you're actually going to see communities that have those grade systems are actually going to back off on them. They're going to put them on pause, because with the FDA code, it doesn't come up with a number, a score, so to speak. So it's not as easily relatable as to a grade, a B grade, a C grade. So we've looked at it in the past, thought about it, doing it, but with the FDA coming in, we wanted to focus our attention really on making sure that our inspectors and our regulated community really understood the nuances of the FDA code before we took on something like that.
All right, thank you very much. And I would echo the mayor, and I know Councilor Camillo and other comments about regionalism. You're a role model for a more efficient use of our resources as a multi-town area, and thank you for that. We appreciate it.
Thank you.
Councilor Nagel?
Thank you, Charlie. We're so happy to see you here again, and presenting each year. It becomes clearer and clearer what the health district does, and I get educated, as we all do, even more than we did before. But so we do appreciate what you and all the towns do to make us safe, and we're very proud of that fact. Our senior center is doing a combination grant effort. You may have mentioned it in your presentation. Yeah, if you know what I'm talking about, I'd like more clarity about it and the extent of it. And also our COVID shots, clinics being continuing or not, and how's that working? So I'll leave it at that.
So, yeah, we actually had the senior centers reach out to us because there was a grant opportunity to be able to focus on, some vulnerable populations, specifically those in the elderly population around flu and COVID vaccinations. So we're in the process of putting together an application with the senior centers and Jamie over there to be able to get some additional resources to help reach out into that community, maybe provide some transportation to vaccination clinics and of that nature to help boost the vaccinated within those vulnerable populations and help to protect them. So that's really what we're doing around that. As far as COVID vaccinations themselves with the district, we really have taken a very focused approach towards our COVID vaccinations. We haven't had mass vaccinations, as we do with influenza, just because in the height of the pandemic and really up to now, they're really widely available. So we've really tried to target those vulnerable populations, those folks that may have functional needs that prohibit them from going to a traditional clinic, and really focusing on them and the homebound to assure that they're protected as well. So having the volunteer nurses that we do, having our own public health nurse to be able to go out and make those types of outreach efforts has really been a benefit, I think, to all of our towns.
Okay, thank you again.
Thank you, Counselor. Deputy Mayor Bedrego?
Yes, as others have commented, I'm really impressed with the number of services that you are offering. It's, goes beyond data collection and being reactive to a situation where, I mean, every year you come here, there seems to be more and more outreach and more programming and being proactive and anticipating, future. And I was just wondering, you have 14 full-time staff. How does yours, based on, the population size of the communities that you serve and the staffing you have, how does that compare to other health districts and departments? And is there sharing of staff and ideas and programming between the other districts?
So as far as staffing itself, I think that what we've seen through COVID is a lot of funding of that basic foundational infrastructure for what a public health agency should really have. So here before COVID, you didn't really hear about local health having epidemiologists, for example. Some of them had public health nurses, and there was always the old saying that if you've seen one health department, you've seen one health department. Well, it's a lot better now. Because I think that we're through that funding, there's been a lot more standardization of the type of services that are really at each health department. The level of staff, I think, really does depend upon the workload that we have as a population. So there are some districts and departments that have a lot less regulated facilities, so they may not need as many sanitarians, or they may need many more. So it really does depend upon the workload and really what we face. Basically, in Connecticut, we have a basic local health program that's prescribed in statute, and that program is set up by the 10 essential services. So we really try to focus on meeting those essential public health services that every resident deserves, no matter in which town they live in. Now, what was your second question? I missed on that.
How much sharing?
Oh, yes. So actually, we work pretty hard to share, resources, share ideas. I'm actually the chair for the regional emergency support function 8, the public health for the capital region, to be able to share ideas around preparedness and planning and response. So we share ideas very well. Public health is really good about sharing information and about sharing what works. and really trying to raise everybody's boat. So if somebody comes up with a good idea, we're all Johnny on the spot to be able to say, how can we implement this? And I'll give you a good example of that. We've had folks reach out to us because we've been one of the few health departments that have been addressing the opioid crisis from the past several years. So we've had folks from Farmington Valley, from West Hartford, Bloomfield, that have reached out to us to say, how did you get to where you are? What are your successes? What would you do differently? So we've actually had sessions to meet with them and provide them with some information so that they can get started and moving a lot quicker. Mostly, public health stuff doesn't respect borders. So the more information that we share, the more resources that we can put together to be able to address issues that come up, the better off everybody is. So sharing is absolutely a good thing.
Super, thank you.
Thank you, Deputy Mayor. All right, I don't see any other hands up, so thank you very much, Charles, and the rest of your folks that joined us. Thank you so much for all
Thank
that you
you.
do and for being here tonight. Thank you.
Thank you. Y'all have a good evening and stay safe
You too.
You too, thanks.
and healthy.
Good night. Good night.
Good night, Roy. Mayor Z. All right, we're moving on now to public participation. Any member of the public may come forward to speak. We do a limit of 3 minutes. We ask that you state your name and address for the record. And if you are in the room, you're welcome to come up. We'll take turns between those in the room and those online. And yeah, you're welcome to come up. Anyone can come forward. So whoever comes up first, and we'll start within the room and then we'll move to an online caller. Welcome, Mr. McGovern.
52 Wakely Road. I live next to a blighted abandoned house, and I was just going through, I was reading the blight regulations in 182-4, and there's about 15 or 16 things that are mentioned, and my neighbor hits on about 6 of them. And the health talk was very interesting too, because I get a ton of mice from my next door neighbor, and so I'm worried about ticks too. I spend a lot on mice poison and that kind of stuff. And I apologize too. I was hoping that Mr. Turco was gonna come here and testify with me, but
He is online in the attendees window, so he may speak after you. I'm not sure.
Okay. So I was just looking for advice on what the next steps that I should do. I'm trying to be as polite and ethical to my neighbors as possible. I don't see them that much. And last time I did see him, we had a pretty heated discussion. And he's unwilling to do any cleanup at all or anything. So I'm kind of in a tough spot. I told him that his property is decreasing the value of my property, and although I've been complaining for about 10 years, the property has been in bad shape for much more than that. And I'm not sure why there's no fines involved or any additional motivation for him to clean up. I think that's all I had. I was just, the health discussion makes it interesting for me because I do worry about the ticks, and I get a lot of mice, and I got glue boards all in my garage for that property. And I put out a lot of tick poison too, and all sorts of poisons on that side of my property. So I'm just looking for advice and counsel going forward on what I can do ethically with the property. But thank you.
Thank you. Ms. Francolino, you're the next one with your hand up.
Good evening, Eileen Francolino, 116 Lydall Road. I'm here tonight to talk to you about the Mill Pond Pool. The Parks and Recreation Department's master plan for 2007, yes, 2007, contained recommendations regarding the future of Mill Pond Pool. At that time, the experts noted that the pool was in bad shape and it was recommended that the pool be replaced. The suggestion was that it be replaced with a mixed-use pool that included recreational features, a spray pad, and lap lanes for competitive swimming. 15 years later, we're still waiting for this to happen, but it looks like the time has finally arrived. This year, ARPA funds as well as state funds are available to offset the cost of this project. This is a once-in-a-lifetime opportunity. Tonight, I would ask the council to commit to funding the balance of this project so that we do not lose the opportunity to obtain this state money. I would also ask that the plans be made available to the public so they can get a better understanding of what we are looking for. Transparency is important. We would like to build support for this project, but the public needs to have access to the plans. Just a quick reminder, according to the CDC, drowning is the leading cause of death in children ages 1 to 4. For children ages 5 to 14, it is second only to motor vehicle accidents. Over the years, the Parks and Recreation Department has committed to offering affordable swim lessons. Our lessons are 3 to 4 times less than those of the private sector. We owe this to our children and we need a pool to make it happen. I ask that you as a council move quickly to show your support for this project. We don't want to fall behind and lose our chance at state funding. It is also important to note that quality education and quality parks and recreation programs drive our property values. They are why people move here and why others stay. Please make a commitment to our children and to our town. We need a new pool and the time is now. Thank you very much.
Thank you, Ms. Francolino. Come right up. Welcome, Mr. Johnson.
Yeah.
It should be, yes.
My name is Dennis Johnson. I live at 64 Garfield Street, Newington, Connecticut. I grew up in Newington and graduated Newington High School in 1974. Last year, I pleaded to this council for relief from Camp Recreate due to bullying and false allegations against my son by 3 staff members and 2 instigating campers. Mitch Page was the only person who reached out to me and asked what he could do. My answer to Mr. Page was to make the harassment and bullying stop. Counselor Page, you did not make the harassment and bullying stop. The same problems have intensified and become intolerable. Soon after my son left camp, he was falsely accused of throwing rocks at a disabled woman while playing at Mill Pond. His accusers approached him from behind, put him in a chokehold while their friends watched, but him no less than 40 feet to the disabled woman. My son was subjected to multiple traumatic investigations by camp staff and to lengthy police investigations where if I did not hound the Newington Police Department to interview a key witness whose father is a retired police officer, Newington police officer, my son could have faced juvenile detention, and it gets much worse. My son's mother is a disabled Navy veteran who was born in Africa to a 100% African mother and an American Navy veteran. My son was accused at camp of being a racist and continues to be accused of being a racist. He's called a white-ass monkey N-word, a rapist, and is being portrayed as a mass shooter. My son's reputation is being mercilessly attacked by MK staff, longtime bullies, and their parents. My son is now facing juvenile detention as a result of false allegations. There is no equity and inclusion for my family. My son's mother was tormented her entire life for being not quite white. The bullying caused long-term damage to her self-esteem and mental health. Last year, after 2 weeks of trauma at Camp Recreate, an assault at Mill Pond, and multiple episodes of intimidation, being excluded and ostracized in our neighborhood, I admitted him to Connecticut Children's Medical Center for emotional breakdown. Now he's being portrayed as a mass shooter, and the Board of Ed is planning on expelling him. Newington has an Office of Equity Inclusion, yet my son is excluded from attending town camp, excluded from playing in the park, excluded from extravaganza, excluded from walking to Dunkin' or Foodland, excluded from riding his bike around, and now he's being excluded from school due to more false allegations and lies and distortions, and he faces an expulsion hearing next week. We have an Office of Equity Inclusion. My son and I are being excluded from life, liberty, and the pursuit of happiness. We see no equity. We see no inclusion. We see no kindness. We see no justice. We see no help to stop what is nothing less than child abuse and systemic bullying in the town of Newington. Thank you for your time.
Thank you, Mr. Johnson. We do have another member of the public online with their hand up. Representative Turco.
Hi, Gary Turco, 98 Williamstown Court. Hello, Mayor and councilors. I hope Mr. McGovern is still in the room and hearing this. I did want to be there in person today, and I did try to email you several times to see if we were still on with coming in person because of the weather, and I didn't hear back from you. But I'm glad that you testified, and I'm going to weigh in as well because I wanted to be there with Mr. McGovern regarding blight issues, and it's also a lot of other residents in Newington throughout my 4 years now as a state rep have approached me with similar issues. And I know I've spoken to the town manager and to the mayor and some others and mentioned that I might come and speak about this issue. A lot of residents are just feeling like the ordinances are not being enforced, or perhaps they need to be improved. And it's, hurting their quality of life, their property values, to have to deal with neighbors who just aren't taking care of their properties, potential for rodents or overgrowth, cars parked all over the lawns. I see it a lot around the Elizabeth Green area as well, where I live, with a lot of cars parked on lawns, which I'm told there's an ordinance against in Newington, but we don't seem to be enforcing it. So besides traffic and potholes, and of course, we all want our property taxes to be lowered, these blight issues are one of the issues I hear most of. And I ask the council and mayor and town manager if you could possibly see if there's any improvements we can make as a town, and if there's something I can do on the state level to assist and work with you on this, I'd be happy to do so. So thank you, everyone, for all of your hard work to improve Newington, and have a good night.
Thank you, Representative Turco.
Good evening. My name is Richard De Silva. I live on Connecticut Avenue. So I was at the Board of Ed meeting last week and listened to the budget and the mayor's comments on the budget. $89 million. Luckily, they knocked it down to 83, but still there's increases in every department of spending. And according to the mayor in her public participation section, our mill rate is going to have to go up. Why is this town being held hostage at the whims of the superintendent of schools and the chairman of the Board of Ed? If we keep increasing their spending and we have to keep bumping up our mill rate, all of Newington will live in high-class poverty. What that means, we can barely afford the houses and cars that are in this town. Speaking of the Board of Ed, as the gentleman before me pointed out, some of their improprieties, there have been other parents that I've been talking to in town that also felt that they've been driven out of the school system here in Newington. They're afraid to come forward because they don't want to be made an example of, similar to he is. And I've spoken to two of them that actually withdrew their kids from school and send them to private school. This pattern of abuse seems to be going on for years, because I am talking to parents from back in the 2010s that have experienced this. Is there anything that you guys can do? Obviously, we can't complain to the Board of Ed. What are they going to do? The Board of Ed investigates the Board of Ed? That is not going to be any sort of justice at all. But I just look forward to any comments from any of the counselors or the mayor about the bullying from the Board of Ed, the superintendent of schools, and the chairman of the Board of Ed, and any comments on the budget. I won't be here to listen to it, but I will follow it on YouTube, and hopefully during your comment section, any of you can give a comment on it. Regardless of whether I like it or not, answers are better than no answers. Thank you. Have a good night.
There's no one else online, so if there's anyone else in the room that wants to come up. All right, seeing none, we'll move on to remarks by, we didn't get any email correspondence, correct?
There's none, no.
Okay. All right. Remarks by counselors on public participation. Counselor Camillo?
My hand up yet.
Oh, it's off. It might have been, got it. Deputy Mayor Badreko?
Yes, regarding Mr. McGovern's concerns, I know after the last meeting, James, we had asked for some kind of follow-up, and I believe that you had a meeting scheduled with the property owners. Can you just update us on?
Certainly. On February 22nd, I met with Mr. Brown, with the new town planner, Paul Dixon, and Eric Hinckley, the zoning enforcement officer. We toured the property. I took some images on that. We met probably about 45 minutes. He indicated areas where he's improved the house itself, done some repainting, cleaned in the backyard, cleaned in the front yard, removed previous vehicles that were stored. That was a junk vehicle. At this point, what the zoning enforcement officer has requested from him, and I'll read specifically from his email. The progress you've made has been good so far. If you can provide me via email response with an action plan going forward to complete the work on the house and the yard, I will remove the property from the blight list. Be sure to include some anticipated dates and actions in your response. Feel free to contact me with any questions. So right now we're just waiting on that piece that was sent out to him. Let's see, on the 27th, that went out to him. So we should be getting some information back. Once that plan is back, I will be sending out a full overview of the previous conditions of the site, the updated conditions, the photos that were taken during our site visit, and his proposed plan moving forward.
Now, has Mr. McGovern been kept in the loop on all
I
this?
believe he was invited to the prior meeting, but he didn't end up showing up on that day. I believe, I will double check with Mr. Hinckley, but I'm pretty sure he had indicated that he had sent out, and let's see. What does your email address begin with, sir?
It's JPMCG.
I will touch base with him. My understanding from Mr. Hinckley was an invite had gone out.
But can he at least be, I mean, can somebody get in contact with him like tomorrow and let him know what happened at the meeting? If there were any minutes, what the action plan is, whatever? Because I know in the past, he said that the communication has kind of been one way. So, I mean, I think this is a start. And if we can keep him in the loop.
I'll put that together in the morning and have that sent out.
February 10th, Mr. Brown said,
Yeah, we don't want to get into that right now just because public participation is over, but feel free to contact Mr. Krasinski and kind of share more information if you have it for sure, if it's relevant. No, it's okay.
I'm good.
Okay. Counselor Page?
Thank you, Mayor. I just have one comment about Ms. Francolino's call. I want to thank Ms. Francolino for her phone call, and I've heard from other folks who share similar concerns. I know I've expressed these before, and we'll continue to talk about the pool as we approach our budget. I am vaguely aware of ARPA monies potentially available and state monies, which Representative Turco and possibly Farrar, but I know from Turco, Mr. Turco, that there may be some state monies in fact available to offset the costs. And as others here and callers have expressed, none of us are looking for the Taj Mahal or any more bells or whistles than we need than to have a safe pool that will last for a generation or more for our kids and our families in the future. And in my view, and I'm part of it because I did the budget last year, we kicked the can down the road, as we all talked about before. And this is an example of that. And I know we have budget concerns that are real. They impact real people with real expenses and real inflation. But this gem, our park and rec, and the pool at the center of the park is essential that we take care of and we make that hard decision, especially when there are monies available. So we'll have these arguments another day. I just wanted to thank Ms. Franklino, and I invite others to chime in. But we have such a wonderful park and rec system. We need to support it and keep it the gem that it is. Thank you, Mayor.
Counselor Rada?
Yes, just a question. I think this goes to James. When does and when will the Blight Ordinance Subcommittee meet? Because I think that's another way that we can be made more aware of what's going on and then hopefully respond.
Yeah, I think Counselor Nagel mentioned trying to call a meeting on that last time when we met.
Yeah, if we have a determined meeting date, then that we can get everybody together for, we can post it and get it started. Last time it was a very long process that was, I believe, 8 pages that we updated as part of the blight ordinance itself back in 2016. That was the first thing I did when I got here, so I remember it well. But yeah, we can begin looking at that information.
I don't think the committee's met since the last election, so there's no chair to call the meeting, so if you
The
could,
town manager or the
yeah.
town clerks, which you get both.
Yeah, if you could send out, that would be great. I'd appreciate that.
Let me look at the language on that, because that may have been a single instance as well, so I have to look and see how the resolution was created, if it actually terminated itself based upon the completion of the project, although we have been appointing liaison membership to that committee. I'll double check on that.
Okay, thank you. I
If the ordinance
appreciate it.
does not allow for it, then we should talk about bringing it back to the council for consideration to either recreate or do what we need to do to ensure that that committee can meet and look at updating that ordinance.
Yeah, perhaps we can have a conversation and then bring that to the next council meeting.
All right, Counselor Ernest?
Thank you, James. The letter that Mr. Hinckley sent to Mr. Brown, did it have like a drop-in date that he has to return the action plan by?
He did not give an action date on it.
So how long is he gonna give him before he follows up with them?
He usually waits between a week to a week and a half. He's usually pretty good about that. He has had correspondence with them routinely throughout this whole process.
I think maybe he should send out another email to him or letter to him saying that you have by X date. And then what the next course of action is gonna be by the town. If this has been going on for 10 years or so, something needs to be done. I totally agree. 2016, when the blight ordinance was put together, is a little different than what it is now, and that definitely needs to be updated.
Yep.
Thank you.
We didn't have a winter last year either, so we didn't have a lot of winter kill. Mice, they're everywhere. Rabbits are everywhere. Coyotes are too now because they're feeding off all of them. And I've got them in my yard. They're looking for my dog. And the times, we're not gonna have winter for another few years. Just looking the way things go. We had the 60s and the 70s. We had great winters. It was nice and cold, lots of snow.
Yeah, the good old days.
The snow was taller because we were shorter.
Yes, but we still had lots of snow. And even in the 80s, we had lots of snow. So I know the house you're talking about, and it has been all of 10 years. At one point, it looked like the whole house was in the driveway. And, it gradually went away piece by piece, but it needs a lot of help. The other thing is the pool. I know we had some estimates to fix the pool when Keith was here. It was about $1 million. And then there was another one for about 3, replace the pool where it sits, and that would include the splash pad that's already plumbed, wired, and everything right by the soft playground. And best thing we could do is knock that pool down, go without it for a year, and put a new one there. That what the state's offering for money, or Mr. Turco's bringing forward, that's more than enough to take care of it. The town doesn't have to put any money into this. Let the state handle it. Half the people that use our pools don't even come from Newington. So the state can help out. And as far as Mr. Johnson, I haven't been directly in that where he is, but the Board of Ed has been victimizing the victim when there's bullying. Rather than take the bullies out of the picture, let's remove the kid and put him in special needs or do this or take him to a private school. Take the bullies out. It has to change, you know, and a lot of these kids that are being bullied are standing up for their beliefs. They don't want to be taught some of this curriculum that's being forced down their throats, and their parents are standing up for them. And then the members of the Board of Ed are saying they're dangerous to what our curriculum is, rather than talk to the parents. You know, I had mentioned giving vouchers more than once here to the people who take their children and bring them to Mano Christian or other private schools. It's a lot less than what we're spending on the kids here. Why? And they seem to be getting a better education. Mr. Johnson, I don't know the whole story, but there's got to be a lot of truth on his side too, for him to stand up here and put his heart on the table about his son and his wife. So it's something we all can look into. He put it in front of us, and hopefully that can be a discussion for another day, but before this son really becomes a victim by our Board of Ed. So, all I can say right now, but I'll say something later.
Thank you, Counselor Menke.
Yeah, I agree with Councilor Page and others. I think a pool is an important part of our fabric of Newington. I think the devil is in the details of where the pool, how much of a pool, and I would urge that if they're planning to put the pool where they were planning to put it last time, they talk to the library people, because that directly affects their programs, because library is right there and that's where parking will be. I also, as I said, the last time the pool came up to the council, I would like to see a proposal for the pools in total in town. I was just on the council only a few months. We had our first field trip and we went out to Churchill Park, and the master plan for Churchill Park was rolled out with a big public meeting and schematics. And we're going to spend $19 million to redo Churchill Park, and the pool and a water slide and a lazy river, and we're going to move where the pond was to where the parking lot was, and the parking lot to where the pond was. And it finally, and I thought as a brand new council, this was the greatest thing ever since sliced bread. And then I realized, who's paying $19 million for one pool? So I think we need to look at our Parks and Rec pools in total. And I don't want to fix one pool and find out we're back here 2 years later. Now we got to fix another pool, and I have to spend another money. And there won't be the ARPA funds money won't be there, and there won't be state money there. And now we're stuck with another pool. So I think we need to look at a plan town-wide and how we want to do pools. And I think all the stakeholders and all the people that are affected, like the library and like the neighbors around, should be consulted and part of the conversation. If that's where they want to put the pool, they need to be part of the conversation.
Thank you, Counselor Menke. Counselor Nagel.
Some of the things I was going to say, previous counselors have already mentioned. So I'll go just in order in which I wrote them down as things to make certain I mention. I agree that the problem is not fixing the pool. The problem is how to do it within the budget, the monies that we have, that the state has available. Do we have to match it? And that it is something that is plausible, as opposed to an elaborate plan that could cost millions and millions, even though the state may kick in money. We have to, and then those monies have to come from somewhere else. Over the years, there have been other things that have been called gems of this town that need work as well. And they are coming up again, and including the library, which is in the process of giving a realistic vision that they feel is needed. And there are others as well. So we as a council, yes, we do wish the best for all, but we also need to manage the monies that the town has available from the revenue that we have, and hopefully that we can find pockets, if for other, I suppose using other words, in order to use it effectively, to solve these problems and these needs without forsaking one for the other, which of course we could say kick down the road has happened because of plans that have been way out of the town's budget in order to do effectively according to the way they wanted to have them done. We have control over the budget. We don't have control over the Board of Education. As we all know from having gone through budgets, we come up with a sum of money eventually to give them, and they are in charge of how they deal with those things. We personally may feel distressed or concerned about what was presented to us tonight, but as so far, I can't see how the council, unless there are some things or changes that are done, that the council can effectively do through our governing process to get the Board of Ed, the superintendent of schools, whoever, all the parties concerned to resolve or to eliminate this issue, not specifically, but the whole idea of bullying, which has been a nationwide issue in many schools for quite a few years. Well, this is one example. It is something that is really a threat to our children, to indeed our education system, and to our communities. I don't see where we have the power to do something given the confines that we have. I hope, maybe I'm wrong. And if I'm wrong, then well, how can we go about helping to effectively come with a positive solution, or at least one that can eliminate what seems to be developing as a problem here within the schools? Last but not least, blight. I have served on the blight committee off and on for many years. I asked, as was mentioned earlier, that the blight committee convene and that we look into our present bylaws, which are laws, if you want to call them that, ordinances that have been developed in the past by many members who have been on the blight committee and passed by this council. There are limitations we have been confined not to be able to go for, including only being the town only being able to see the front of the establishment to determine if there is blight or not. At the present time, we don't have the jurisdiction to go into backyards and so on, and that seems to be a problem. I realize that it creates a difficulty in terms of one's personal rights as to how much the town can investigate beyond what we have already. But it appears that we need to do that again, and I hope that indeed the committees meet again, not just to meet, but to try to do something to see if we can get some more equity out of this for all individuals and still make it a positive outcome as opposed to a punitive one for all parties concerned, which is, I'm sure, not what we want to do. We want to correct the situation and to make all our neighbors feel as though they are living in town in a community that is well taken care of or is working towards that end. So, enough.
Thank you. Counselor Page?
Thank you, Mayor. Just two comments. One about Mr. Johnson's statement. As others have commented, I felt compelled just to say that I don't think it's our place to comment on the policies or procedures that the Board of Ed and the superintendent are following to address Mr. Johnson's concerns. I'm aware, having worked in schools as some of you have, that there are policies at the state level and there are agencies that field those complaints, and there are procedures for staff and administrators and teachers, as the Board of Ed well knows, to file complaints and in fact requirements to file complaints about bullying. And it's the state's job, and I believe the Office of Civil Rights and other associated bodies, to follow up with that based on the validity and legitimacy of that complaint, those complaints. So I would encourage Mr. Johnson and anyone else who feels they're suffering from this type of thing and they're not feeling their grievances are being heard at our level, meaning the Board of Education, that they should go to the higher authorities and seek justice and seek attention to that. I just have one other comment about the pools, and I respect Councilor Mankey and other people's comments about budgets. That's what we're all about. We need to steward our resources responsibly. I am very frustrated, though, with what appears to be hand-wringing over what, yes, was the Taj Mahal, as I understand it. I wasn't there, but I've heard about it and read about it. That was once presented. And rather than hand-wring over what was a BMW or a Mercedes or a Lexus of a proposal, I mean, my Chevy I drive, my 12-year-old Chevy I drive, because it's what I can afford and it works just fine. That I suggest that, and I think I asked this of our interim town manager a few meetings ago, if possible, could we have a presentation on what the bare bones would look like, what a mid-size, mid-cost vehicle would look like? And if we want, let's look at the big old Mercedes or Cadillac, just for giggles, I guess, because that's not what I want to buy. I want a Chevy that works. And yes, I think Councilor Mankey's comments about doing a systemic review makes sense, and a comprehensive review, so we're not robbing from Peter to pay Paul, and then we're shortchanging the other park. But I urge us to do it and stop talking about it. So thank you.
Councilor Donahue?
Yeah, as apparently still the chairman of the building committee for Mill Pond, it's not a building committee. It's Bill coming to us and saying, this is what I want. So it's an approval committee. It's not, when it's like, well, if I can't get everything, I'm not, it's like, and this is where I want to build it, and don't suggest that we move it somewhere else. Okay, I can tell you that the plan, part of the plan was the expense, and the second part of the plan was where it was going to be. Okay, I mean, in the Mill Pond people were already, revving their engines ready to come back. Now, I mean, I've seen a couple things where there's another place for a pool, right? But let's Tim said, let's look at both pools. We don't want to spend $9 million on a pool and then have the people 5 miles away from this pool complaining that their pool is a piece of crap, right? Or maybe make a decision. One becomes a splash pad, one becomes a pool. They are literally, I don't even think they're 5 miles apart, right? I mean, it's staggering to me that, with 13 square miles, we got 2 pools that are, one should be good, one should be the other. But if it's going to be the building committee, which still exists, or the new building committee, it's got to be a building committee. Come to us with your plan. Let's discuss it. And, Carol, you were on it with me, right? So let's discuss it. That's it for me. Thank you.
Councilor Camillo?
That's where it should have gone, really. You made a nice splash pad. You've got mostly kids in Mill Pond Park. You make the bigger pool, one pool for the whole town. If it needs work, take care of it there. The money saved by getting rid of the pool in Mill Pond is huge. Where Bill wanted to put it, we wouldn't be able to have an extravaganza anymore. So that's one thing. Bill, you want extravaganza or you want a big pool? So, and you had just mentioned when there's a problem, for civil rights and everything for Board of Ed. Well, I know Mr. Johnson went to the Attorney General, State Board of Ed, and then a message was sent back. And it's easier to put his kid in another school than take care of the project, and that's where it went.
Councilor Mankey?
Just a quick thing. There is a blight ordinance subcommittee. Braverman, Mankey, and Nagel are on it. But it does say blight ordinance. So I'm not sure that wasn't just a committee formed to change the blight ordinance back in whenever we met. But it's something, if we need to have a blight ordinance steering committee, we can certainly form one. And just a quick comment, public comment, council comments and public conversation, public comments should be.
You're stealing my thunder.
Should be comments. We shouldn't.
I was trying to be patient.
We've debated back and forth with each other, and everybody should get, in my opinion, of course, I have my second shot at this because I'm up again, but I think it should be one comment and then move on. This back and forth doesn't get us anywhere, and we're talking about stuff that's not even our agenda, that we don't even have the information for. So I would just urge the councilors to just try to keep their comments to public participation to just one shot and to the comments. To argue back and forth, I think does us a disservice.
All right, thank you. I get a turn now.
Oh, sorry, time's up.
I was trying to wait because I did give someone a second chance. So then when other people raise their hands, I had to give second chances to everyone. I'm an equal opportunity caller honor. But I have the town council rules of procedure open on my computer because I was looking to see if there was anything like that. I think we had that at some point And maybe we do need to adjust our rules of procedure to make sure that counselors are, we shouldn't be debating an issue during remarks by counselors. We should be responding to what the members of the public said from our viewpoint if we choose to, and that's really the purpose of that. So moving forward, I will be trying to keep us on track a bit more with that. I gave a bit of latitude tonight, but I agree with Councilor Menke on that. And now I'll address a few of the things that were mentioned already, but specifically, blight was already addressed. In terms of the Board of Education budget, Mr. De Silva came forward on that, and just so the council knows what my comments were that evening, I did want to educate the Board of Education on kind of how we as a council look at budgets maybe a little bit differently than they do. They're looking at what the service is, how much it costs, and what can they put forward to us. We're looking at it as mill rate oftentimes, right? That's our job. Our job is to set the mill rate and pass that to the taxpayer. So what I explained to the Board of Education that evening was that, and this is loose math that I was just doing as we were sitting here, the increase that they're requesting is almost $4.7 million above their budget of last year, which was $78,660,000. They're now asking for $83,342,000. So rough math at $4.7 million on our end for our budget, our mill, one mill, when we talk about mill rate, is equal to approximately 1.4. I'm sorry, 2.4 is what I meant. 2.4. So when you add 2.4 and 2.4, that's 4.8. Their budget's at 4.7 million. So that's the equivalent. Their ask is the equivalent of 2 mills on a mill rate, if you think of it in terms of the dollars. Now I'm simplifying it a bit in terms of, there's revenues, there's cost sharing money. And so I'm simplifying it, but when you look at the dollar amount of the ask, it is the equivalent of almost 2 mills in a mill rate. So we have to figure out how to fund that. Is it coming from which ECS always goes straight toward their budget? And that was a question that they had for us, and that ECS goes into general fund and we pay for the budget out of that. So long-winded answer is that's what I said to the Board of Ed was that, we have to look at it now as mill rate and how do we offset that ask of 2 mills? How are we going to offset that so it doesn't just say, hey, taxpayer, here's your extra bill for that, right? That's our job now. So that's what they need to understand. And I think the general public needs to understand when we're budgeting that it's not just, oh, it's 5.95%. Well, 5.95% equates to 2 mil. So those were my primary comments. And I asked a number of questions that evening, and I have not received any correspondence. It's the second time I've asked in public session a number of questions to the Board of Education and asked for responses. I've not yet received that, and that was last Wednesday, so it's almost a week. So if I get responses to my questions, I will certainly forward them out to the council so everybody has the same information. And then in terms of the pool, I will say, you stole my thunder too, Councilor Donahue, because my primary concern about the pool is that every time we say we are willing to move forward with a pool, but we have constraints as a council, as the taxpayers, there have to be constraints on projects. The response we get from Mr. DeMayo and the Parks Board is too bad. This is what we want. This is what we're putting forward to you. Either consider it or don't. And so they force our hand each and every time to either approve or disapprove. That's a game that's getting old, as Ms. Francolino mentioned, since 2007. This has been on the burner, I guess, right? But this council, last time it was discussed, was very specifically concerned about locating the pool on Garfield Street for a number of reasons, and everybody has their different reasons. But for me, the primary reason is that we already have a huge parking issue here on this complex. Huge parking issue with Parks and Rec Community Center, Town Hall, Library, everybody vying for the same parking. When there's an event in the park, there is no parking. You come here for a meeting, too bad, you better walk from down the street. There's no parking. We add a pool to that mix right on Garfield Street. Where do you think those folks are going to park? Do you think they're going to park over on the extension street down where they park now? No, they're not going to. They're going to look for parking up on this end of the complex, and that's an issue. And we've said that over and over. And from my understanding of the parks meeting the other evening, the only option they talked about was putting it back on Garfield Street. They didn't discuss other options that we've heard about moving, putting it down where the playground is, putting it on the little sliver of property. And maybe there are reasons why, but I guess we need to hear that. So until I hear that information specifically, I don't think we should be debating where, what, how, until there's a formal presentation put together, and it has to include options other than Garfield Street, in my opinion, if they want me to consider it. And then for Mr. Johnson, my first comment is I offer him my sympathy and my wholehearted sorrow for him and what he and his son and his family are going through. You can tell from his passion that it has been quite a battle for him and his son. And he has spoken at a number of meetings. When I was at the Board of Education meeting last week, he was there. I saw him doing an interview in the hallway. I'm assuming he did one again tonight because I heard some voices out there. He did mention that he spoke with you, Counselor Page, but I'm going to tell you, I've spoken with him on a number of occasions. I'm not sure why he's acting like that didn't happen. But I had a meeting with him in person here in Town Hall with the previous town manager when he came and complained about Camp Recreate and had specific concerns to address. The town manager and I met with him. We heard his concerns. We addressed his concerns. And then there was a meeting with the Camp Recreate staff. So I just want to make sure that folks understand it's not that things are being ignored. And there are two sides to every story. So from our perspective, the things that we at this council table have any purview over would be Camp Recreate is under the purview of the town. We don't have control over that, but we can direct the town manager to intervene if there is an issue that we would like him to intervene on. And in terms of the police department and their actions, they fall under the auspices of town council and town staff. And so Mr. Johnson is really begging us to look into some of these allegations. He's given us written permission to look into some of this. I would ask the town manager to contact the chief and see if it's appropriate. And if I'm wrong and maybe it's not appropriate based on, privacy issues, ask if it would be appropriate for an executive session of this council to hear about the police involvement in this case and to be able to understand we've heard Mr. Johnson's side, we need to hear the other side. If we're going to be involved in this and he's going to continue to come forward and ask for that and wants us to be involved, then perhaps we need to get involved, at least on the levels of things that we can have some say in. So those are my two thoughts on that. And Mr. McGovern, I know he's extremely frustrated, but I have talked to our town manager a number of times and the previous town manager a number of times, and I have been assured that there is a lot going on with our town staff and that property, and they are out there regularly monitoring it. There have been a number of improvements made to the property. Mr. McGovern is characterizing it as though the neighbor is not doing anything, but the information I've gotten is that the neighbor is doing things and is making improvements. So it's awfully hard when that's the information we're getting on our end to respond to what he's saying. So just putting it out there are two sides to every story, and please do not ever assume that we're not addressing both sides. Just because we don't speak about it publicly doesn't mean they're not being addressed. All right, that's enough. I'm off my soapbox. I waited a long time to talk. All right, we are now moving into you like that? I'm sorry. And I apologize if I'm standing up and down tonight, but my back is really bothering me. So if you see me standing, I'm not acting strange. I'm just stretching. Next item this evening is consideration of old business. We have before us the discussion of proposed ordinances for tax exemptions. There are 4 that we discussed last time that are in our packet again this evening for consideration or discussion, I should say. I don't believe we're looking to take action. We still had a number of questions outstanding from last meeting. So I will open the floor to begin discussion of property tax exemption for Gold Star parents and spouses. Counselor Menke.
Before we get into all 4 of these, just a general point, before we take any action on these, there will be a public hearing on all 4 of these. And the public will have a chance to weigh in at a public hearing before we take action. So I just want to make sure that we aren't, even if we wanted to pass them tonight, we would have to go through the public hearing process. And I think that's important for the public to know.
Okay, thank you.
I'll take my hand now.
Thank you. Any other counselors on this one? I mean, I can offer from my perspective, this is one that we just haven't had in the town of Newington before. It's something that the state had recommended a number of years ago. Fauna, if you want to weigh in too, I'm sorry. I forgot your on there with us.
Okay, you're doing fine.
To me, this is a no-brainer.
Right.
And I don't think I don't know if anybody would apply for it, but if there was a family that was deserving of this, then to me, this is a no-brainer, and I think we should, support what's before us on this one. Deputy Mayor Bedrejko?
No, I just want to say, as having had a family member who, my nephew was killed in combat, so, no amount of money can make up the cost or the sacrifice. And I would hope, quite frankly, that that this does pass, the public agrees with it. But my big hope is that we would never have to, there would be no applicants
exactly.
for this particular program. So.
Absolutely. Thank you. Anyone else on this one? Okay. Fauna, did you want to add anything to that one?
No, I'm good. The only thing I think in your packet, we changed the effective date on that just because I wrote these probably last August or September, well in advance for signing of the grand list, but we missed that. So it would just be effective for October 1, 2023.
Oh, okay. I see it. Thank you.
That's small, but
Yeah. All right, and then next in our packet is the exemptions for veterans or surviving spouses. I know we did talk a bit about this one last time in terms of the income or the amounts that are listed and what was required by the statute and what we wanted to offer. So I'll open up the council discussion. Crickets? No one? Okay. Then I'm going to assume that what we have in our packet is, go ahead, Councilor Menke.
Just, I'm trying to read through it quickly, and I don't know if I read it this afternoon or not, but is there do you have to apply for this every year?
it's every other year. So
Every other year?
yeah, the idea with this program is there's a state program, and then we have adopted our local option, which is that one that's in front of you. And it would just run with that one. So when they come and apply for the state, they'll apply for the town every other year.
And is my other, I assume this is what would happen, but if I was a veteran, which I'm not, and my house got the exemption, and then I sold it to my son or my daughter, not to exclude one or the other, that they get in the house. With that exemption, then that would stop, because now the house would no longer be in my name, right? So it would automatically sunset?
It would be removed, yeah. Unless, part of the program is that you have to own the home and live in it,
Right.
So if you sold it to your children, then they'd know, unless they were veterans, they would no longer be eligible.
And I will sell to either one of them. I don't want to make one think they're gonna get the house and not. Yeah, I don't want to read the minute meetings and say, oh, I get the house.
All right, Counselor Camillo?
Sorry about that.
Okay. All right, any other council comment or question on that one? Cruising right along. The next one before us this evening is the tax relief program for certain homeowners age 65 or over and permanently or totally disabled. Fauna, I had one quick question on that one, just in terms of the title. I think the title says permanently or totally, but then in the first paragraph, it says permanently and totally.
Okay, I can look into that and see. If
I just didn't know which one it really, or if it makes a difference, but it should be the same, whichever it is. Yeah. Okay. Counselor Rada.
You said exactly what I was going to say, that
Yes, I beat the editor.
Oh, but I have some minor ones that I'm gonna give to James later. Yeah, it was the same thing that, in the body of the purpose, permanent total disability. So, that's why I was questioning, that it's and rather than or.
Yeah, they have to be 65 or older or permanently disabled.
But it's between the permanently and the totally, where it says permanently or totally, and then in the document it says permanently
and total, and in the rest of the body of it, it's permanent total disability. So I think that's what I was suggesting. We take out permanently or and change that to and.
Okay.
All right, any other council comment or question on the tax relief program for certain homeowners age 65 or older? No? All right, lower that hand, and then we're moving on to the next one, which is the ambulance type motor vehicle exemption. And I know we had talked quite a bit about this one, and there were some things that we had agreed upon striking out, which I believe, James, you provided everybody with an updated copy with some strikeouts and changes. Oh, right here, okay. I will say what I liked about this is that it's limiting it to the one motor vehicle per household, which I think is very appropriate. And we took out the restriction on the license.
Yep.
Okay. Deputy Mayor Bedrejko, your hand is up.
Yeah, Fawn, I was just wondering, I fully support, this, this ordinance. But my question is that in terms of, I don't know, there's just something about it that's just making me a little bit uncomfortable. Because, and I understand that that modifications to support a disabled person can be quite costly, which is what this ordinance is trying to address and help the family or help the individual. But a modification can cost maybe $500 or it can cost $50,000. You could put a modification in a vehicle that costs $15,000 or a vehicle that costs $150,000. It just seems that in terms of equity, I mean, if you put a $200 or $500 modification into a $150,000 vehicle, it seems the impact is bigger on somebody who has a $15,000 vehicle and has, a $5,000 modification. It just.
Right. Yeah. I mean, I totally agree with you. We do have to put some sort of, we've tried to tighten it up. The license thing was rejected last time. We do still have that the owner must have a doctor's note to prove that they are disabled and they need that modification. You are perfectly, as the council, able to define, how much modification you want. That's up to you. You can have it be as much or as little, but it looks like that portion was taken out where we said at a minimum, the vehicle must have blah, blah, blah. So this is up to you guys. So
I was just thinking more in terms of, some kind of cap or limit in terms of if the intent is to ensure that the individual or the family doesn't have to pay an excessive cost for modification, couldn't the exemption apply until the modification is 100% recovered from the tax exemption? I mean, is that?
I don't think we can put a dollar amount on the modification. Unfortunately, I think you have to say what the modification is. I think there's in that statute, if you read it farther down in some of the amendments in the past, it says that you cannot put a dollar amount.
But what if you said something and not put a dollar amount, but until the cost of modification is 100% redeemed or repaid?
Yeah, I don't think we can make a monetary
at all.
I think it's either they qualify based on how we've written it or they don't. They get the whole vehicle, or they don't. So I think unfortunately it's they get it or not. It's a yes or no. I don't think we can trigger it based on money spent.
Okay, thank you.
You'll see that actually on the screen, the statute that's there. The end of the first line and the beginning of the sentence indicate that by ordinance, it's exempting the vehicle itself from personal property taxation. There's not a dollar amount that can be attached.
Okay, okay, fine, thank you.
Councilor Rada?
Yeah, a couple of questions I had. Number 3, where it says owned by the parent or guardian, and what about spouse? Do we include that or not? I know farther down, it also talks about parent or guardian. That was one question I had, is why we don't include spouse.
I mean, yeah, that's easy enough.
No, go ahead.
I think put that on there. Yeah.
Okay, no, I'm sorry. What you were gonna You had something else to say, Fauna. I didn't want to interrupt you.
Oh, no, it's okay. No, you're good. Go ahead.
Okay, under definitions, just a disabled individual, as a result of the individual's medical incapacitation, and we've got and/or permanent disability. And then it says the individual's disability must be permanent. I don't know, is the and/or ambiguous?
Let's see. There's his license.
Yeah, if we're requiring it be a permanent, then the
Yeah.
and/or shouldn't be there, you're saying, right?
Yeah, I'm thinking and permanent disability.
Okay.
And then on the second page, or is it number 3 under application, it says physician's letter is required at time of initial application or is deemed required by the assessor. And then number 4 says at the time of initial application, the vehicle will be inspected to confirm modifications required as noted by the physician. So I think in number 3, could we end at the time of initial application period? Because the next one says they have to have that information available to even be able to apply.
Okay.
Except for a
I'm
couple
cheating.
of apostrophes, which I'll give to James.
Yes, yes, please.
I'm good to go. And thank you very much. This, this is a heavy lift, and thanks for doing all that work.
You're welcome.
Counselor Page?
Thanks, Mary. In response to Counselor Pedreco's concerns, do we know from your research or experience if other municipalities have had problems with a similar policy and it being in any way, and I say this cautiously because we're helping folks who are suffering, and so has there been any downside for the towns? Are you aware of any of that? I'm just addressing Councilor Pedreco's concern.
No, I do not. And when I gathered them from a bunch of towns, I actually called a few and got their input on how they've written it. A lot of these towns that do have a more in-depth ordinance was done for reasons. So I think a lot of the towns that only have a few sentences, their ordinances have not been revisited in a long time. Like New Britain is pretty extensive, and they just updated that. So I think it's a good thing for us to get it on the books, but also to define how you want it to work. So.
Right, because as the gentleman who testified a session or two ago, we want to be thoughtful and sensitive, all of us here, to not make it so prohibitive that it may look good, but the poor folks can't take advantage of this necessary benefit. But to Councilor Pedreco and others' comments, we want to also still make sure we're doing it in a fiduciary responsible way.
Well, and currently you really technically don't have it at all. So, getting it in the books and getting it defined will make it on the up and up.
Thank you.
You're welcome.
Counselor Mankey?
Yeah, for all 4 of these ordinance, I think I would request that a few months from now, maybe 9 months or after October 1st, you give us a report of just what I appreciate your memo here saying what the tax implications of these are. I think we have to remember that what a tax credit here is a tax increase over here. And I have no problem with giving any of these people tax increases. These people exemptions. I'm sorry, these increased exemptions. Now, whatever. I have no problem with that. I just think I would like to see if by changing our ordinance we've changed these numbers any. I don't suspect we will, but I just think it'd be good for the council to know if there has been a change. So thank you.
And we did want to go over the one thing. I don't know if it's in your packet or not. I think it is, where we put a little summary. But somebody had $1,500 in taxes. Oh, I lost my paper. Too many papers. Oh, there it is. So currently our benefit program, this is the local option additional veterans, is $10,000. That's off the assessment. If we had discussed a tax reduction of $1,500, that would equate to an assessment reduction of $39,000. So that'd be 29,000 in assessment over what we're currently doing. And that would cost, the program's currently costing us $40,000. It will bump it up to 150,000. That's just so you know, that's what he was just mentioning, the numbers side of things. I didn't write that in because I didn't know if we were to go with that. But that's what that would equate to.
And Fauna, that was your recommendation based on what? How did you come to those numbers for us?
The $10,000 assessment was what we had been giving.
Right.
And I believe that was set by a resolution probably around 2015.
Yeah.
Along with the $45,000 income limit. The $1,500 tax reduction, I believe that was mentioned last time. And I can't remember which counselor suggested that, but I said I would get the number.
I did it. It was me.
Yeah.
It was me.
Yeah. So, I mean, overall, it's not huge, but you know, every dollar counts these days, so.
What was the $1,500 based on? Was that just a number you came up with, Counselor Camilla, or did you get that somewhere like from another community?
Thought it was a good number for our veterans.
Other council comment or question on that one? All right. Oh, I think you answered this last time. In the handicapped ordinance one, there's a line under both the, I can't find it now, under the disabled, under 3A and 3B, the comfort line.
Uh-huh.
And I greatly understand what you're saying about comfort versus disability, but that would really be determined by the physician's note, right? I mean, if the physician says it's.
If the physician says it's necessary, then I think we could count it as qualifying. But if somebody just comes in the office and says, why not? You know,
yeah.
At least we say, well, at least our fallback is always the physician.
Physician,
okay.
Says it's required. I mean, who are we to say that it's not? You know,
yeah.
At least we're putting together some parameters, which I think is important. But you know, if a physician says it's necessary, then it's necessary. I mean, that's how I would do it.
Okay. Counselor Camillo? Are you?
Yeah.
Okay. I don't trust your hand right now because you've been.
Part of my thinking with that $1,500, I mean, we have the Veterans Hospital right here in town, and our veterans go to West Haven.
Our veterans go to, I'm going to interject. Our veterans go to West Haven for certain services that aren't offered in Newington,
Right,
like
which-
surgeries and that kind of thing.
There's a lot of things that aren't offered here, but that costs money too. And I haven't met anybody that goes here. I mean, you've got some new guys that just came back. They'll start here and then they end up in, and I just think they should get more than they're getting from our federal government, and we should take care of them.
Just my experience, because I live with a veteran who does access VA healthcare, a disabled veteran. They do provide mileage costs. So if you do have to go down to West Haven, they will reimburse you for your travel expenses as well, just so you know. Counselor Mankey.
Just one quick thing, and I don't want to knock you to death, but the doctor's note of fund, it doesn't have to have any specifics. It just says patient X needs this on his card to.
That's all. Yeah,
you don't need pages and
no.
pages of diagnosis and medical records.
No.
You just want to know.
No,
Thank
no.
you.
It's just a doctor. No, yeah.
Counselor Page.
Just to clarify, is the $1,500 that Counselor Camillo mentioned, is that, we're talking about putting that into the document? I'm not against or for any number until I have some parameters from either other municipalities or guidelines. And I appreciate sincerely Counselor Camillo's gesture. I mean that. And I would like to have as greater a gesture. I think though that I would be comfortable with just looking at what are those parameters, either from other municipalities or other governing bodies. And can we get some reference points? That's all.
Right. Every time that gets brought up from the administration or staff, well, let's see what other towns do. How about we just be the leader once in a while? the way I'm thinking.
My comment would be that you have the right to ask for that information if you'd like it. And then we can choose as a council if we want to
Right.
be in line with another community or be a leader and do something different. But if you would like that information, Fauna could probably get that for
Could
you,
we
right?
get some parameters on it? And we may end up with 1,500, we may end up with more. I'm not saying it's a bad number. I'm just
Right.
saying, I would just feel comfortable if we had some ceilings, floors and walls around us as we make it.
Yeah, we could certainly do that. And we do actually have more time on this one because this one would go into effect for October 1, 2023 as well, because we missed October 1, 22.
Thank you.
Councilor Page, you're all set, right?
Yes, ma'am. Thank you.
All right. So next steps for us in terms of these 4 ordinances?
The last step I'd like you to look at would be a possible new name for this ordinance. Specifically, this name is the same name that we've had because it was specific at the time to just
For which
ambulance
one?
vehicles.
Oh, the ambulance one.
Ambulance, yeah, 'cause the ambulance.
We
doesn't
asked that last time.
accept
Someone
it.
did ask that about the name and we said it was related to the statute.
Yep.
Right?
Right, this one, we only had the ambulance vehicles and that's why we named it in our code that way. The statute itself is municipal option to exempt certain motor vehicles. If you want to utilize that as the section, because we are entailing all 3 sections of the proposed ordinance, that's a possible change.
Say it again, municipal option.
Right on your screen, municipal option to exempt certain motor vehicles.
Yes, I like it.
And
Fine
when
with
this
that.
ambulance thing,
Yeah.
things I'm driving an ambulance. I agree.
That's fine.
Yeah.
It's not gonna play at Vegas, but it works.
Or Broadway.
Right.
I'm taking a picture of that, so I remember the wording. Got it.
So our next step will be similar to what we're doing this evening next, which will be introductions will be added at your next council meeting for scheduling of a public hearing. You'll be able to receive public comments at that time. After that, you can make any additional changes to that ordinance you may choose to based upon any information which Fauna may supply that she gets from any other town agencies that have higher, lower, or the same limits in their ordinances. And then adoption would go forward. Doesn't have to take place that night, especially based upon some of the information may take a little bit longer, but effectively, once you've held your public hearing and you've made changes, you are not required to hold another one.
Good.
Okay. So we wouldn't have to take action that evening. We could if
We could if we want.
if there's no changes, like the Gold Star one doesn't seem like there's any questions on it.
Correct.
Yeah.
But those other ones where we may get more information, we could still deliberate further and then vote at a later meeting.
Unlike what we did with the Public Building Committee.
Right. Okay. Are we good with all that, counselors? Consensus?
I'm good.
Okay. Then we will move those to the next agenda to set the public hearing. All right, next item this evening is the ordinance amendment, Chapter 8, Commission on Aging and Disabled. We are looking this evening to introduce the ordinance and set the public hearing. And you'll remember this was related to the membership, and this was an ask of the commission. They brought it forward. It really started, the conversation started during charter revision when memberships were discussed, and the commission expressed a concern with not being able to consistently have a quorum, or actually not have a quorum for quite some time, and had asked us to consider reducing membership on the commission so they would not be running into that problem anymore. So I will open it up for discussion. Or no, there's, I'm sorry, there's no discussion. We're introducing, so who would like to go ahead and read the introduction? Thank you, Counselor Nagel.
Introduction, I hereby introduce for the town council's consideration the proposed ordinance amendment to Chapter 8 Boards, Committees, Commissions, and Bureaus, Article 5, Commission on Aging and Disabled, Section 8-16 Membership Terms, a copy of which has been filed with the clerk of the council. Resolved that the Newington Town Council hereby schedules a public hearing on March 14th, 2023 at 6:45 p.m. to consider the proposed ordinance amendment, Chapter 8, Boards, Committees, Commissions, and Bureaus, Article 5, Commission on Aging and Disabled, Section 8-16, Membership Terms, a copy of which is attached to this resolution.
Seconded by Counselor Camillo. Question on the introduction.
No discussion, but Counselor Nagel, as the introducer, may discuss it or state to it.
Anything you'd like to state? I knew we couldn't discuss content, but I didn't know if the date or that was open to discussion.
I know that the commission, after hearing, after our fall elections, which included revising the charter, that the Commission on Aging had a difficult time in terms of getting a quorum for a variety of reasons, and wish to both the commission and also Jamie over at the Senior and Disabled Center wish to reduce the number of members of that commission from 9 to 7, and thereby reducing, so there would be equal representation by both parties in that commission. They met several times. They agreed that indeed this was a viable thing to do. They had many problems with getting a quorum, be it via Zoom, let alone in person. And as I think I mentioned at the last meeting, to ensure that they had a quota, even though they had more than just the minimal amount, that the chairman of that board, who was in Portugal, I believe, zoomed in to make certain that they had a quorum to continue. If this goes through, it will alleviate the problem of being able to have a quorum and to be Zoom or no Zoom, and to continue the functioning of the board, and obviously help to the senior center to move forward with its programs and items that need a council or their council or their board to approve amounts of money to pay for things.
Okay, thank you. All right, so we have a motion, we have a second. All those in favor signify by saying aye.
Aye.
Any opposed? Motion passes unanimously, and we have our public hearing set for the 14th. Next item is the Recreation Trails Grant application. James?
So the planning department, with our new planner on board, who will be introduced to you at the next meeting, is finalizing this application. Actually, we had the mayor sign on it this evening. We're waiting on a letter of support from the town of New Britain and West Hartford. We did receive a letter of support from CROG, in addition to the program, as well as I want to say maybe New Britain did send us one, but we were waiting on the planner specifically. It was the town engineer, I believe, that sent us one. So we'll be prepared to move forward with this. Hopefully we can turn this more so into the regional as we're proposing it, which would connect New Britain, Newington, and West Hartford, and tie in the dead end that happens at our fast track currently, and actually get some funding into the town. So this will, the due date for it is tomorrow, so we are wrapping all of those pieces up between the next 24 hours. We're just waiting on one letter of support from the town specifically, and actually it's from the Historic Society. So I'm waiting on Mr. It's James Late. He actually supported it last year. We sent him over the letter, so hopefully he'll be sending that back over this in the morning, and we'll have that included in the proposal to the state.
Did you mention the connectivity piece that I know you talked to us at agenda about that, but trying to kind of tie in the connectivity to other towns with the trails?
Yeah,
right?
it'll connect in. We've got it proposed to come in from New Britain, tie into the Newington hub of it, as well as tying into the West Hartford piece as well. So it would be a full connectivity going through. And that, we believe, is going to give us a greater point base. Unfortunately, we're not a distressed community, so we lose 10 points off of that already. But anything that we can do to add into the program and the project is a plus. So he has been working quite hard on that, and I'm very pleased with all the work he's got done.
Excellent. Deputy Mayor Draco?
I think, just regarding the connectivity, the fact that there already is that established trail for biking and hiking in Newington, New Britain, but then this is proposed to go to the Trout Brook Trail in West Hartford. And eventually, who knows from there, you can go into the Farmington Canal at some point. And it does say that this will be multi-use, so I would hope that it's bikers and walkers as well. But I also like the fact that it's kind of tied in and it's in this application to the fact about the Newington Junction historical loop as well. That would be a perfect like middle stopping point for people, maybe if they're biking or this trail. So, I mean, this is just I just hope that. You got it. Yeah.
Counselor Rada?
Yeah, I know this is a feasibility study, but it's exciting to see how this can move forward. One question, it requires a 20% match, and I know it can also be in kind. Has there been any discussion as to where that 20% match is going to be coming from?
That's actually a funny story. So we actually got some contact through Superintendent DeMayo in New Britain. They actually offered to pay the 20% match for the design. Not quite sure if they'll be able to do that, but it was an offer that they had made. But no, we do have funding that is available for
How
our
long
in-kind.
is that string?
Yeah, that's what I'm wondering as well. But no,
No,
as part of
that's-
our previous funding from the budgets, we do have matching
Okay.
funds that are available.
Cool. And one quick edit on attachment F.
He has been editing this too, so he might be ahead of you, but let me get to that. Yeah. Go ahead.
The feasibility study. Instead of student. Attachment F, maintenance plan, town of Newington.
Oh, I'm on 22. Okay, there we go.
Unless it's a feasible student. Should be.
Yeah, that, we'll touch base with him in the morning on that one. No problem.
I couldn't help myself.
Good catch.
He's probably listening in as well because he did last time as well. So he's probably already made this change.
Well, good job. I mean, this is exciting. I know we're all waiting to hear how this is going to shake out. Thank you wherever you are.
Counselor Nagel?
Yes, thank you for following through with this, James. I'm happy to say as a liaison off and on for many years with CROG, to finally see something brought forth. Usually we're brought forth with projects that have to do with bridges that are another section of the region. And of course, we as a group want to give more power to them to get their projects done. And this is one where we are directly affected. And it also shows that we are a leader in terms of doing this kind of connectivity, which was just previously mentioned, which hopefully will go all the way through the district and create opportunities for people to see the advantages of many towns, and most importantly, the benefits of Newington, as was previously mentioned by our deputy mayor. Thank you again.
All right, thank you.
You did receive a copy of the CROG support letter
Yes.
in your packet, actually, so on the screen for the public as well. So luckily, the regional director for us, Mr. Matthew Hart, who I met with beginning of this week, last week, sorry, is very supportive of it. And we'll address that a little bit later in my town manager's report as well.
Okay, great, thank you. Any other council comment or question? There's no action on this?
No
just
action on this
informational
required.
item. Okay. Moving on, the next item this evening is the job description, carpenter LT 14 and electrician LT 18. Mr. Kapinski?
Yes. So these were job descriptions we were proposing to put before you. We received a request for impact bargaining through the ASME unit, and we actually now have a new representative that is coming on board who has just asked us to hold off on any approvals on them. We can take them up at the 14th meeting as well. There's just minor changes. And there's some issues with the electrician's position specifically. You'll notice in your packet there, for both of them, the carpenter position as well as the electrician's position, these are technically the approved job descriptions that we have on file. In 2016, we actually utilized a draft version of the electricians upon our hiring posting for the union. That's what brought us into other issues. And that became the impetus to reviewing the carpenter's position because that position became vacant. When we looked at it, we realized neither one of these had been updated in quite some time, as you can tell from the copy. And they just asked us to hold off on them. And I indicated to them I was happy to indicate to the council to request to table them until our March 14th meeting. At that point, we can take up any proposed changes that may come out of our discussions.
Reasonable.
Sounds reasonable, Councilors Wu.
Yeah, okay.
Go ahead, Councilor Camille.
New representative coming on, is there any chance that we can meet him? Have him come in or her come in and
If he's
introduce themselves, a little about themselves, so we know what you and other people are dealing with the union. So
I can address that with them. I believe we will be meeting on March 6th. We were proposed to go in for a grievance hearing at the Department of Labor. Luckily, the discussion I've had with him and through our labor attorney is they will be withdrawing those grievances. We're hoping they'll also be withdrawing the MPPs, municipal prohibitive practices, as well for that, specifically to subcontracting. But we'll be addressing the other issues and hopefully have those cleaned up shortly.
yeah,
But I'll be happy to
it would be
address that
nice
with
to
them.
meet the person that's coming in, and just so we have a good understanding of what happens in the future and who they are. And
Sounds like you made some good progress with
We have.
some of the issues that you were faced
Excellent.
with. Thank you.
Thank you.
All right, moving on. Next is the acting town manager appointment and employment agreement. Counselors, as you know, we did appoint Mr. Krapinski as the acting town manager in alignment with our town charter. The appointment is only a 90-day appointment by charter. So the council needs to consider, it's not reappointment, it's an appointment. So we have to appoint again, an acting town manager. We can choose anyone that we would like, including Mr. Krapinski or not. I have proposed that option, because by charter, it is just a 90-day appointment. So it is not a reappointment by charter, it is an appointment. Because this is old business, it's been done in the past and discussed. We can take action this evening, and we would want to in terms of timeline. So I would recommend that we continue on the path with Mr. Krapinski as our acting town manager while we continue the search process. In my estimation, and what I've seen from Mr. Krapinski, he's done a wonderful job of jumping in to fill a vacancy for us and has gotten quickly up to speed on issues and has established himself with, I mean, you were already a town staff member, but in terms of switching roles and acting differently, I think you've really managed to jump into that and do well with it. So I would recommend that we continue with Mr. Krapinski, but I would certainly open the floor to other suggestions.
second that.
I agree.
Counselor Page.
I would just add, thank you for all your hard work and everything you're doing.
My pleasure. I've actually enjoyed it. It's a little different than what I've done downstairs. That's all historical. This is making history.
That's good.
That's
That's
cool.
cool.
I
like that. As a history guy. Instead of, reading it, you're writing it.
Deputy Mayor Bedrejko, if you would read the motion in the packet.
Resolved, the Newington Town Council establishes the following with regard to its appointment of James Krapinski as acting town manager. While serving as acting town manager, Mr. Krapinski shall receive a salary of $5,769.23 biweekly as of March 3rd, 2023. All of Mr. Krapinski's existing benefits will continue, modified as necessary to reflect the change in salary from his position as town clerk. 2, while serving as acting town manager, Mr. Krapinski shall have the unrestricted use of a town vehicle. The town shall be responsible for all costs relating to the operation and maintenance of said vehicle. 3, Mr. Krapinski shall have the right to return to his position of town clerk at the conclusion of his term as acting town manager or upon removal as acting town manager, except in the case for cause removal. 4, the town shall furnish and provide Mr. Krapinski with insurance protection, including comprehensive general liability and errors and omissions coverage applicable to all acts or omissions arising out of his employment as acting town manager. 5, the council reserves the right to remove the acting town manager at any time for cause with 6 affirmative votes.
Second.
Seconded by Counselor Menke. Any discussion?
I just have a question. question, is this for 90 days?
Yes.
Okay, so that we don't need to put that in here.
I think pursuant to the charter, it is a 90-day. Yeah. All right, all those in favor signify by saying aye.
Aye.
Any opposed? Motion passes unanimously. Congratulations or condolences, depending on how you wanna.
Depending on the day,
Let's see how the rest of the week goes.
depending on the day.
All right, we are skipping over our original item 8, and we're on now to refunds. Deputy Mayor Badreko?
Resolved, the property tax refunds in the amount of $1,150.32 are hereby approved in the individual amounts and for those named on the request for refund of an overpayment of taxes certified by the revenue collector, a list of which is attached to this resolution.
Second.
Seconded by Counselor Nagel. Any discussion? Hearing none, all those in favor signify by saying aye.
Aye.
Any opposed? Motion passes unanimously. Next for this evening is approval of minutes, and we have for our consideration the February 6th special meeting and February 14th regular meeting. Counselor Nagel?
They're fine. There may be some typo errors or whatever, but for the most part, they seem fine for me. I also want to mention that I specifically look at areas where I'm involved and I don't look in detail to what everybody else said. So I approve them with that caveat so other people on this council know.
Would you make the motion to accept those minutes from the February 6th, 2023 special meeting, as well as February 14th, 2023 regular meeting minutes?
So moved.
Thank you.
Second.
Seconded by Counselor Rada. Any other discussion, counselors? Counselor Ennis?
From the vote on the February 6th meeting. I was out in attendance.
Would you like us to separate those
Separately,
out?
please.
Would you amend your motion to just do the February 6th first? Thank you. And would you amend your second?
Second.
Thank you. So we are voting only on the February 6th meeting minutes first. All those in favor signify by saying aye.
Aye.
Any opposed? And any abstentions?
Aye.
So motion passes 8 positives and 1 abstention, 0 no's. Thank you. And would you now make a motion for the February 14th minutes?
So moved.
Thank you.
Second.
Seconded by Counselor Rada. Any further discussion on the February 14th minutes? Hearing none. All those in favor signify by saying aye.
Aye.
Any opposed? Any abstentions? Vote passes unanimously. Next item this evening, we're moving into new business. And in our packet, we were supplied with an AMR agreement extension. Mr. Kropinski?
So I was reached out to by Attorney Palomino, who my understanding was speaking with the NEMS committee to request the extension of their current contract because the current NEMS plan is coming up or has already expired. If I'm not sure, maybe coming up for this June. Councilor Ennis? Yes, thank you. And we are not expecting that would be completed and reviewed by the state prior to the expiration of AMR's agreement. Their agreement actually expires June of this year as well. So it was a request put forward to extend their contract out for another 2 years and a request to remove a penalty section under their original contract, Section 5 of Exhibit A. Other conversations I've had seem that it may be of interest to table this one to allow the committee to review some information and bring it back to the council at a future meeting.
Okay. Counselor Ennis?
Yes, I think, and I agree with the acting town manager, that this needs to be reviewed by the EMS committee before it comes back to us, and they should be the one bringing it to us. And I know they're meeting on March 16th, so I would ask that this be put so for further discussion after the March 16th meeting. We do have plenty of time since the AMR contract does not expire till June 30th. So we do have plenty of time to discuss this. But definitely the EMS committee needs to review this and make recommendations to us.
I am okay with that. The chairman of the committee is here this evening if you do wish to address anything with him.
Or if you want to say anything.
If you
Do you have
want.
anything you want to share? Are you in agreement?
We'll have something, we meet on the 16th, we'll be able to have it all ironed out and have it to you for your following meeting, so.
Okay.
I don't anticipate any problems, but hopefully it'll go.
You said exhibit A?
Yes, if you look at the back of the contract itself, past the signature pages, it's actually called, I'm sorry, Exhibit 2.
All right,
Section 5 penalties.
I
the last page.
was
Sorry.
feverishly looking for exhibit A. Okay.
I didn't turn the pages. I was trying to go off of memory there. It has.
Motions to table that?
Do we need a motion to table or do we just choose not to take
We're not
action?
tabling it. We're just gonna leave it.
Yeah.
So if we don't bring a motion forward, it would automatically just.
Go to the next bit. So it'll be old business.
Correct.
Next, yeah.
Okay. Thank you, Patrick.
Okay.
Five, is there a reason for that?
Review and the ability that AMR has done so far, we've determined that the recommendation was to remove that. They haven't had any penalties over the last 2 years that we've had to assess on them as we had previously, where we actually entered into the agreement with them about 4 years ago for, was it 19? Yeah, where they had over $200,000 in penalties. We actually came to a stipulated agreement between them for $100,000. And we haven't had that issue since.
Could I just would ask that the NEMS committee review this section to make sure there are no penalties. I mean, they're saying they're not, and we're saying they're not, but I would like to have the experts say there's none. And I point to you as the expert.
Yeah, so a little history on that. I was on the EMS committee.
Kevin, can you just, or Mr. Ziegler, sorry, can you use the mic just so members of the public can hear you too? Thank you.
So a little history on that is, I was on the EMS committee probably 12 years ago. And at that point, we reviewed every single time that AMR came into town, their late overages, we fined them, they got fined dramatically over time. Since I came out of the committee, apparently that went away, excuse me, and fines had stopped. The last contract, they did away with that because they were being fined, but Newington EMS was not being fined. But, you know, there was a difference of response times and difference of who is being responsible for what. AMR, right now in the contract, it says that they can review their own response times. I mean, that's something that has to be addressed. We need to look at the overall picture, but we need to do something temporarily so we can figure out what is going to happen in the town for EMS. Something has to change in town, something has to move forward. We need a buffer. The EMS committee needs to sit down, address the EMS plan, submit it to the state, get that approved, and then move forward with looking long-term. Where the town's gonna go, how's it gonna be funded? Do we continue with AMR? Do we go to another service? Does NEMS do it 24/7? So, you know, right now they're not being fined because nobody's reviewing their data. They're reviewing their own data and submitting it, saying, okay, we're good. So, I'm not against leaving that for now, but in the future, we're gonna have to look at that long term and see. I mean, it is affecting their response time, so.
Well, that's a concern for sure. So we would look to you guys as the experts to.
And that's something that we need to address as an EMS committee and go back and see how things are going, how we wanna go, how the town wants to go, and then bring it forth to you folks to see how you wanna go forth and how the town manager, whoever he or she may be, how they want to go forth in the process.
Okay, thank you. Counselor Page?
Thanks, Mayor. Not to go down a big rabbit hole. It's late. I know everybody wants to go home. Just at some point, can I get educated on response time? My layman's understanding was that whether it's AMR or our folks, is that there's some objective marker of response times by a machine or by a computer, and that data can and maybe should be subject to anyone's purview and transparent. Is that not the case?
Yeah, it's kind of complicated.
So, and not to go down a big time.
No, but there's a national standard for response times for EMS. Lights and sirens, priority 1 for critical, it's 8 minutes, 59 seconds. No lights, no sirens. It used to be 12 minutes. I think they moved that up to like 14, 15 minutes as a national standard. Because if you're going no lights, no sirens, the patient's not critically ill. and with the EMD process and all the different processes we have. But again, there's response times, and before, if they were over that response time by 3 or 4 minutes, they would get fined, opposed to now, they could say, well, by the time Newington got the call, by the time it got forwarded to AMR, by the time we dispatched, even though there was a 4-minute period of time, their dispatch time is, so they're making their response times. So there's just a lot of complex situations, the EMD process, rolling the 911 call. And again, this is all coming back into the EMS plan. And when we do the EMS plan, it's going to concern dispatch and EMD and whether we continue to roll it to AMR, whether our dispatch center has to take it on and hire more dispatchers. We have to look at all of that in general.
Thank you.
It's a big process.
Yes, thank you.
Sounds like it.
And just historically, I think in 2015, when there were all the issues with the fines, part of the concession that we agreed to in terms of the kind of forgiving a little bit of the fines and keeping AMR on was that they would have a vehicle dedicated to Newington full-time.
In Newington.
In town. So I think, back then that made a lot of sense in order to make sure we had better response times for our residents and that we were meeting the needs, right? So that is something that you would reevaluate and look at.
A lot of times it's not the first call, it's the third, the fourth, the fifth call, which when we did the fines before, if they went 3 or 4 calls deep in a matter of 15 minutes, then the fines just kind of went out the window because you're taking 3 ambulances. And Newington will do that. Newington will take 3 ambulances in a matter of 20 minutes. So, it's a busy town, there's a lot of calls. So, there is definitely a structure to it. And I could see why they did away with the fine schedule. I'm not saying that we need to go back to fining, but there has to be some overall picture on what's going on. And we will, look at all that.
This is for both you guys. When we do our new EOC, will we have fire being dispatched by one dispatcher? Same thing with ambulance and police, be 3 different, or will it be one person taking all calls? And that's where you run into a problem. Hartford ran into that problem, and now they have individual.
The EOC is not a dispatch center.
You're not gonna
That's handled through the police department itself.
Okay, will there be help there in the future as we grow with our ambulance?
At the EOC?
No, with dispatch with police, because right now it's just police.
That's a conversation they've got to have with dispatch directly and see how the entities are going to interact.
And, the PD is involved in it because the police department's the R1, so they go to every medical call. So it's not just NEMS, it's not just AMR, it's the town has a global picture that we have to look at. And that's whole part of the EMS plan that we have to submit. And actually, we have to have the EMS plan for this year by, I believe it's June 23rd or 24th submitted to the state. So in the next 2 months, we're going to be working very hard, very diligently to get that plan submitted to them. And again, right now we want to get a plan to them. We want to keep services to the town of Newington, and then we want to look to the future and say, okay, where do we go from here?
Thank you.
So I think we're all set with this one. We'll not vote on it this evening. We'll refer it back to the committee, and then we'll look forward to hearing from you after your meeting. Okay, thank you. Next item this evening is job descriptions, groundskeeper 2 and groundskeeper 3. Mr. Krasinski.
So these job descriptions are part of discussions that we have had with current union leadership local. It has been discussions that we've been going back and forth on proposed settlement agreements, but we feel that the information that is updated within these job descriptions is relevant to the position as it is. So even if we can't come to a settlement agreement and we at some point do move people into these positions in groundskeepers 2 and 3, it's a benefit to have them updated at this point. Last update to these took place in 2005. We have updated some information specifically. You'll see highlighted who they report to, just some of the lower classification work that's included with it, as well as additional equipment that we have taken on board as a town that they would need to be aware of. And knowing that they would be required to operate it, there has been training that has been taking place through the Parks Department. So they are having seat time in new equipment. That's been, I've had with the superintendent and his staff to ensure that the membership is getting that training. And then the only other things are just calling out overtime winter storm operation, which of course we got to see today. And then we are looking at the requirement of the possession of either the pesticide applicator or supervisor license. We are proposing that the town cover that cost for the individual who has to hold that licensing. That would be something that we'd have part of the budget itself. So you will see pretty much they're both the same job description. There are minor changes between the groundskeeper 2 and the groundskeeper 3. Again, the supervisory to who that is now the groundskeeper 4 person to this individual versus the groundskeeper 4 versus the gets fun. Groundskeeper 4 item versus groundskeeper 4 person. I hate it when they do that with jobs. And again, basic computer knowledge, because this individual on the groundskeeper 3 would be handling more supervisory work. Again, the same work with the equipment. There is one item that was removed, which was the I believe it was the bucket truck. We made so many changes on these in so many meetings. Where are you?
The ability to operate, but not limited to 75-foot bucket truck. Is that what you're?
Yeah, we actually, that's the piece I was looking for. So in the groundskeeper 2, it's tractors and backhoes. In groundskeeper 3, it's simply tractors because the upper levels are required to handle lower levels. So they requested we remove that one from that specifically. And then, as I indicated, winter storm operations and then the supervisory pesticide license. So they can only hold one type, whether it be applicator or supervisory. The supervisory has the applicator under it, so they don't have to hold both of them. So we did remove that under this job description. So both of these, as long as nobody has any issues with them, we put forward on the March 14th meeting, as well as when we finish our discussions with the union for the carpenter and the electricians.
Quick question. The groundskeeper 2.
Yeah. The proposed.
Is someone that's hired from outside into that position or can be promoted into that position?
Because it's union, they're internal first for up to 5 days, so they can vie for that position. Should they not have any applicants to it, then we would go to the outside.
So what I'm questioning is under the required minimum qualifications, if someone has been here for a few years, can they promote into this job? Or it's?
Oh yeah, our groundskeepers ones could promote into this job. We've had some people who have been here up to 13 years.
Okay, the way it's worded, it says 2 or more years of experience within previous 5 years immediately prior to employment.
We struck that.
Oh, okay.
We struck that piece out. It's simply two years or more of experience in landscape maintenance, parks and recreation.
Okay, that I saw in the groundskeeper 3, but in the groundskeeper 2, it's still in there in the packet.
No, I just read that from groundskeeper 2.
Am I looking at an old one?
You're looking, make sure you're looking at the top of it based upon the approved.
Okay.
So that'll be where you'll see the differences.
Got it.
And that's why we're proposing to remove that piece.
Okay.
Yeah.
Okay, thank you.
My draft ones didn't come out with my markups on them, and I'm not sure why.
Thank you.
And the screen as well as markup, so.
Okay. Thank you for clarifying. Any other questions? All right, we'll move this to our next agenda in consideration of action. The next item this evening, based on our changes, is the fire truck lease.
There we go. Let's see. I'm not sure if Janet wants to take this one over or me. She's back on with us. So we just receiving the aerial platform truck that we ordered back in 2020. And
no, it's 2021. Sorry, James.
Right.
So
thank you.
In September 2021, we got a lease for the aerial platform truck. We've actually already made 3 lease payments, but we finally got it delivered this past month. They, the paperwork that needs to be completed couldn't be done until we received it, and it's the certificate of acceptance and the insurance information. When you originally approved us doing this lease in, 2021, it was then town manager Keith Chapman. So we kind of have to get approval for James to complete all the paperwork as acting town manager.
And originally you thought there might be a need for a waiver on this, but there is not.
No, I don't need a waiver on this.
Okay,
If we get anything to them after the next meeting, that's fine.
Okay, perfect. Any council comment or question? I have one for the commission. Are they gonna have us in to christen it with a bottle of champagne and then we can use the hose to spray it off, or?
Good question.
I think we should get to try it out,
Go
but
for a spin.
it looks awfully pretty. I know they've posted quite a few pictures on Facebook I've
is
seen, and it's
beautiful.
a beautiful truck for
Sure
sure.
is.
Counselor Mankey?
At the last fire commissioners meeting where I attended as a liaison, they did talk about having us all down to see the fire truck.
Oh, good.
They said we couldn't drive it, but we could, or go up in the ladder, but we could actually see it, which would be kind of cool. Just a quick question. This truck is not online yet, I take it, from what my understanding. So, because we have to sign insurance papers, so I don't have it
Right.
online. We don't have insurance, so
No, they still have to fit it with equipment and everything from what I
right, so
hear.
it still has to go someplace to be outfitted, and that I was told that'd be take a couple, maybe up to a month to
Okay.
get the
Could,
equipment
yes.
on it.
Yep, that'll go to our highway department.
So we may look, if we may get to see it, but it'll be a truck
Little ways
without
out.
hoses and all the bells and whistles that we used to see in a fire trucks.
Well, we can wait.
We could wait, yeah.
Everything
The
to
truck's
be
not
there for the
going
bells and
anywhere.
I want to
whistles.
see the bells and whistles, yeah.
Yep.
Any other discussion on this one? If not, we'll move it to next agenda. Okay. We are on now to written oral communications from the town manager.
We've already taken care of regarding Wakely Road and my visit to them. As soon as I have everything compiled and the proposed plan from Mr. Brown, we'll put that out as a full packet for all of you to be able to review history on that. Let's
Quick
see.
question, were you guys able to access the backyard of that property?
Most definitely.
Only because I drove by the front of the house just to kind of get eyes on what Mr. McGovern's been mentioning, and I didn't notice anything from the front yard, so I wanted to make sure that
Yeah.
we'll get an update on the other.
From the right side of the yard in between the two houses, Mr. McGovern's and Mr. Brown's, there's a small pathway to be able to walk back through very easily. It could be just like anybody else's backyard. Oh, I left my chairs out all winter long. But I'll have photos for everybody. to
But
be able
Mr.
to
Brown
see.
was compliant and allowed you to
Oh, yes,
look
he
through.
brought us around
Okay.
through the whole entire thing, pointed out areas where he had been working on the house, repairing old cedar that was on there that had degraded, painting. So he's been working on the house piece by piece, but of course, the middle of winter, you're not going to do painting or repairs, especially at his age. But he is working towards that, and you can definitely tell the improvements that I've seen even from 2021 to current day from former photos that I've seen.
Okay,
So.
thank you.
Good news on the horizon. Hopefully by the middle, at most the end of next week, we will have closed on National Welding. We finally got verification back of our budget that we supplied back in December that they decided to put into a folder and ignore. So that budget has been updated and submitted to them. He indicated it should come back very quickly. Mr. Shu is already aware of the timetable on that. He has a copy of it. And as soon as it comes back, I will be sending that over to him and we'll be setting up the closing for that property. Earlier this week, I met with Matthew Hart, which Dave is very familiar with. He's the executive director of CROG. All of you received at your table this evening a flyer regarding the services that have been provided to the town of Newington over the past 5 years from our dues. And, you know, he has asked in the future to come before us just to talk about programs and abilities to assist us in reviews of projects and other items that they handle through CROG. We are in the final stages of completing the questionnaire for the community survey. They should be sending us over the test survey by the end of this week for us to be able to just play with it, make sure everything's working properly. We have gotten together the required addresses for sending out the postcard block, as well as a online QR code and website address. We'll put it on ours as well as the other entities such as Senior and Disabled Center, the library, community center, those other entities out there to allow us to be able to get a, oops, darn it, got in my way, to allow us to get a broader scope of responses back. They're hoping for at least a minimum of 400 back in the first 3 weeks, but if they get them back faster than that, we'll get data back faster than that. And then the last piece I have for you this evening is, we've talked about this in previous councils, setting up a policy regarding sale of town-owned land. So we do have a lot of parcels that are out there that can be put back onto the grand list. One specifically I met with on Friday with the acting, well, now the CEO, the former acting town planner. And this is a stub road off of Timothy. It backs up to, you have a stub road you didn't know about.
I didn't know there was a stub road named after me.
What happened was, when the original development went in, it tied into another parcel. So it was meant officially to tie back into East Robbins, but it never did. So it dead-ended, parcels sold out over the years. So there's a stub road that we've had since, I believe, 1925. It's been part of our approved street plans. And what this does is it ties into a rear lot. So it can't be developed because it's a rear lot. It doesn't have any frontage on a roadway. We need to determine a proper policy as to how the council wants to go about that. Is it simply, we're going to notify the abutting property owners, give them the ability to do a right of first refusal and offer it out? Or do we go through an entire full bidding process, such as a tax lien sale style, and utilize it that way? So it's a conversation I'm going to start with the town attorney, see what he's got for recommendations, and then it will be something we most likely will be bringing to the council. They do have an interest in the purchase on it, which would allow us for another developable lot. And then if we do go about the purchase on it, there'll still be, prior to sale, the 824 referral to TPC, the report back, make sure it's a viable sale. So we do have a lot of protections that are in place prior to everything happening.
Great.
So that is all I have for tonight. I know that's a lot.
Thank you. Comment, question?
One quick
Yeah.
question for your consideration, James. Can we look into, maybe you've done this already, CCSU or UConn or other college intern who's in computer science or web design to hopefully free, get them to work with our various programs and our building here to update our websites and our access of forms and so forth. And again, maybe y'all have started to have done this in the past, I don't know, but I know if we can do it for free and a student can learn and apply their trade and get on the resume, that would be great. Thank you.
I've had that conversation with the IT director. He actually has 2 outstanding positions that he can't fill right now. One is our GIS coordinator, one's a network administrator. But I have asked him to reach out to CCSU, University of Hartford, and just to see anybody who's in the computer science program who may have an interest in either the positions in an interim phase or as a permanent. So we are looking into that as well. He actually does have on his radar an update to our website as well.
Thank you so much.
Yeah, because we are past our 5-year period for that, so we are in a renewal phase. Yes.
Okay.
Thank you.
You're welcome.
Counselor Nagel?
I have some questions, and it's mostly good. It's good to see projects moving in town, be they private or be they public. I've noticed in various different sites online that Anna Reynolds meets kind of a milestone in terms of the building project. Do you have any update on that?
I will actually have more of an update on Thursday. My understanding is they were getting close to finalizing the interior work. They were doing what is that? Sheetrock of a certain area. They did some blasting of paint, which caused a improper surface to be created on some of the brickwork. So they actually did that as a full wall over, but they had already remediated that area. But I will have a meeting with them on Thursday, so I'll be able to get more information. We can send that out to the commission, to the council from the commission.
I've seen pictures and whatever of a wing being opened for some classrooms that are ready to be used. Have you gotten?
Yeah, well, when they were starting the first phase of the development on the site itself, they actually walled off the entry in. So they were doing asbestos remediation, clean out, rebuilding. They were rebuilding the elevator pit for access to the second floor area, because as we all remember from the former visit to that site, the ramping system and the stairway. So now there'll be an elevator to access that directly and allow for more access. So they've been doing quite a bit of work. I haven't been on the committee since our new Director of Administrative Services has come on. I haven't had to be at that meeting that much. But they are moving along quite quickly. The last I'd heard, they were a little bit ahead of schedule.
I also noticed that in driving by the other day that the Kellogg house roofing is started, and that the carriage house it's a whole different color roof because of the shakes and whatever. What about the central house? Did they put a different roofing on that, or is they're working from that to the central house?
That I couldn't tell you. I know that was part of a SHPO grant that Mr. Salamone had applied for. I would have to look to see how much that project was entailing.
Okay, because I've seen
I know most of it was
equipment and
entailing
whatever,
the
but I
main
couldn't
house.
tell one or the other. One you could definitely tell.
Yeah, I believe it was entailing mostly the main house because that's the area that they did the spray foaming on, which caused the issue with the shakes.
Yes. Oh, do I know? Also, it's, as you mentioned, you have commercial property that we have, National Welding, we want to get there, and it looks like we're almost there, which has brought about other properties being developed around there and around town, and it's good to see various places that's happening, and also work being done on some apartments that are, whether those of us on the council at the time approved of them being in certain places or not, there is work now being done on it. The most of all the questions in town, you're not even, well, maybe tomorrow's snow removal, but at the present time, most commercial question I've had right now is, what is the supermarket going in? Whether I'm 1333.
Come on,
I
you
know
can
you
tell
probably
us.
can't answer that.
I don't even know.
Yeah.
Okay, so you
They're
haven't
very
gotten
tight-lipped
any
about it.
updates in terms
Developer
of
is so
of
tight-lipped
that
on
or
it.
any other properties and their development, or when they
Lots of
expect to be.
I wish I know, because it's always fun to guess. Is it going to be an Amazon? Is it going to be a Trader Joe's? What's it going to be?
It's amusing, some of the names that are put on Facebook that you know.
But no, whether it's
Yeah.
another store from
Yeah.
down south or what it is, I don't know, unfortunately.
Well, thank you for the input.
Wish I could give you more.
And I disagree. The biggest question I get is the car wash on the road, which
Yeah.
I know you had said,
Yeah.
but do we know that that's moving forward?
Last I heard, they were, there's been a little back and forth. They had the little step up in the process where they were having a difficulty connecting with MDC's trunk line. That had to be fixed, but some things have just taken a little bit extra time.
Okay.
I know the developer has mentioned that he wished he hadn't gone so bright.
Yeah, right.
Because everybody notices.
Which is funny, because he came in with a subdued plan to TVZ and they said, oh, no, we like the first one you gave. So,
Interesting.
yeah.
It's bright,
Well, he'll like
It
it
is.
once he opens and people take notice.
We'll know exactly when that opens. up.
especially with all the salt on our
Yeah.
cars now. My car looks like it needs a wash.
Yeah.
Definitely.
Just gotta remember to keep your foot off the brake.
Counselor Camilla?
Yes, sir.
On the town side, we use Munis. They also do web pages also for the other towns that do use it, and they're user friendly. Everything's there, PDFs, forms, buying permits, dog license, everything. It might be something we could look into since we already use Munis.
Yeah, we can look at it. We will say that we are working on, and I think Janet's still on, she's been working on a employee portal. I'm not sure where we're at on it. There was a little bit of a step back on getting some of the forms for population through them, but that is something that we'll see in this first quarter, most likely.
Yeah,
I
James, I'm still here, James.
Yeah,
We are working on the employee self-serve, and our next step is to actually go and put all recruiting on the website also.
Nice.
Nice.
I use the employee portal where I work through Munis and it's wonderful.
Yeah.
You know, all my certifications are in there and my absences and your time entry and everything's in there. It's great.
That's what we're working towards.
Everybody good?
Yep.
I'm sorry, I missed one thing. It's something I thought about as I was going through. We actually found some more money. It's an old project, which one is for Garfield Street. We actually have another grant project for the Stoddard and Main area, which is about $801,000. So we are looking for the award grant on that one as well. We have confirmed it's there. We just need to get the paperwork so that we can create the accounts for it. We're confirming that the connectivity grant for Cedar Street is still available. Hopefully we can tie that in with some of the work the state's giving to us for some signage for the curb access. They've got some free signage that's coming to us, as well as possibility of adding that road in as a project in this coming year to be able to do the entire renovation as well as the roadway reconstruction. So hopefully we can tie that all in together.
Counselor Page?
Just real quick, just a point of clarification. I may have misunderstood whoever said it, but if you were under the impression that the state monies that would be available for an eventual pool would pay with ARPA most or all of that, it isn't. My understanding is the state monies would be matching to what we put in.
Right.
So maybe y'all knew that, but I didn't want there to be a misunderstanding. Thank you. That was it.
Thank you. All right, moving on to council liaison committee reports. Counselor Manke?
I just report that the search committee is meeting tomorrow at 6:30 to finalize the application or the profile. So we'll have that out. There's been a lot of back and forth. It seems like every time I print one out from my printer, there's a new one. And it's costing me a fortune in ink, but that's okay. So we're meeting Wednesday, and it should be just a formality, but we will then bring it back to the council. We may have to maybe do a special meeting if we want to get it done sooner, but we will try to get it back to council as soon as possible. But we are working steadfastly on that report.
Thank you.
For that profile.
Anyone else? All right, moving along to public participation. Any member of the public may come forward either in person or online. If you are in person, please feel free to come up, state your name and address for the record. If you are online, in the Zoom application, you can raise your hand in the participation window. And if you are on your phone, *9 will accomplish the same. I do have one hand up in the attendees window. Ms. Lyons?
Hi, Rose Lyons, 46 Elton Drive, and Mayor Del Buono, I'm feeling your pain as I watch you get up and down and stand behind your seat, and I'll try and make this as short as possible. Let me start out by saying that today marks the 75th anniversary of my father's and our family moving into this home. After he got out of World War II, he got the money to build a house in Newington, and when he completed it, he wasn't sure how long we could stay because his funds were low. But here, 75 years later, I still remain at 46 Elton Drive, and I'm thankful for that, and I'm thankful for everything the town of Newington has provided, not only for myself growing up, but my daughter as well. And I appreciate all the suggestions that were made for tax relief for veterans. I'm very familiar with that because my father received tax relief, I believe, and if my brother was living here in the house, he's a Vietnam vet, he would be receiving tax relief as well. As a senior well over 65 and low income, I do receive the senior tax relief. I appreciate the suggestions that the increase or the change be made from a $10,000 deduction to a flat $1,500 off of the taxes be made, but I'd like to see some backup. I would hope you would get some backup material. I know that the assessor, I said it was like 40,000. It would go up way over 100,000. So that's something to think about. As far as the benefits that the VA or the veterans get in this town, I think we're very good to our veterans. At least I hope we are. My brother gets services as well as many of his friends up at the VA hospital. We have the the Victory Gardens for homeless or in danger of being homeless vets. We have our American Legion Hall that I believe that our town basically maintains that area or that building, and I appreciate the fact that, you know, they have a place to go and they're doing a great job with the veterans. As far as the pool situation, I feel like I watched Facebook Live tonight going back and forth about what's going to happen in Mill Pond, what could have happened at Churchill Park. Can we just get the superintendent of Parks and Rec in and have him make a presentation to the town council and then decide whether or not the pool committee that was formed is still in effect, or if it's going to be the permanent municipal building committee? I'm all confused, and watching tonight, I know no more than if I had looked at Facebook and watched what was going on. As far as repair of the pools and the state grant, I highly doubt that the state grant is going to be to repair a pool. I would think that it would be to build new, and it would be matching grants. I once again want to stand on that. I do not, I for one, do not approve of ARPA monies being spent for that pool, unless some of that money also is spent to take care of the South Park branch of the Park River, because that too is an issue to me. All right, that being said, thank you again for all you do. And Beth, I do hope you feel better. Take care now.
Thank you. Thank you, Ms. Lyons. We have Mr. Leverrier is next.
Hi, good evening, Mayor Del Buono and members of the town council. Richard Leverrier, 3 Winterberry Court. I just wanted to chime in as I am a member of the Board of Education regarding a member of the public who came forward in bullying matters involving son. Although I'm being cautious as what I'm saying, the public of it, but I mean, what I want to say, individual did come in about some of the issues, and I have, in me, I have done everything that I can do to try to help resolve this issue. I had earlier asked for copies of any kind of bullying reports for involved this student, and the superintendent of schools refused to give me that information. Basically told me to stay out of politely. She politely told me just to stay out of it. And we had to go as far as having a private meeting with me, superintendent, the board chair, and the Board of Education attorney, wherein the message was relayed, they don't have to give me this information. I had said, well, we can maybe get this information in an executive session for review. And the board chairman at that time told me to my face that he would not support any kind of review regarding that matter. I want to just make sure that that information is known. Yeah, that's all I got. Thanks.
Thank you, Mr. Leverrier. Any other members of the public that would like to come forward this evening? Eileen Frank, hold on. You didn't do that, right?
Didn't do that.
Not it.
Ms. Francolino, your hand was up, it went down. If you do want to be recognized, I'll just wait a second to see if your hand goes back up again. Okay. Yeah.
Okay. I think I'm gonna go with she's trying to and she keeps hitting it too fast.
Done.
Hello.
Oh, there she is.
Hi, Ms. Francolino.
Hi, I'm Francolino, 116 Lidle Road. I felt like I had to come back on this evening due to the immense amount of misinformation regarding my comments about the pool. I know, like, we've beaten a dead horse here a little bit, but there are a few things that I wanted to clear up. First of all, out-of-towners are not the people who use the pool most, not even close. It's the campers that come all summer. As far as any of us know, there is no wiring for a splash pad at Mill Pond. When that playscape was built, splash pads weren't even a thing. Mr. Mankey can testify that We did discuss other locations for the pool. We met with Mike Fortuna. He explained that that little piece of property on the other side of the pond is too small. It's too close to the pond, which is, the water table is wrong, which is why it can't go where it is and it can't go on the other side. He's an expert. We have to go by what the man says. There's been absolutely no talk about taking away the soccer field on Willard Avenue. That hasn't even come into consideration. We wouldn't even do that. And as far as building a Taj Mahal, that's why I want the plans out there so people can see this. Yes, when we first took the plan into consideration for Churchill Park, a lazy river was included. And the reason for that was that we had some parents come to the board to say that they had some adult children who were had some mobility issues and some special needs, and that they had just gotten back from a park that had a lazy river, and it was the first time they had ever participated in an activity that they could feel like they were a part of, and it gave them a sense of belonging. So we included it in there, knowing full well it was going to be the first thing on the chopping block, but it was something that was asked for by the community, so we were trying to respond to their needs. This new version of the pool is much simpler. It's basic. It meets the needs. Yep, there's a slide and there's a diving board, but that's what kids go to the pool for, and I don't think that's excessive. I would fully hope that people would either listen or read the minutes of our meeting, or Mr. Mankey can report, or I would be happy to come and let anybody know what we talked about, because we do talk about these other issues, and to say we don't is just, it's just wrong. Thank you for your time. I appreciate all that you do.
Thank you, Ms. Francolino. All right. I don't see any other public members coming up, so we will move on now to remarks by counselors. Counselor Mankey.
Just to respond to Mrs. Francolino, I did not report, you spoke with any other, the Parks and Rec Board spoke of any other areas or options. I didn't report either one. I only reported that I was in favor of Councilor Page's idea that we get a pool suggestion with sort of 3 tiers of what as he spoke as the car, the base model, the middle model, and maybe the upper class model. That's all I reported on. And I did report that I believe that whatever discussion happens about the pool, if you're going to use that current location that the board is thinking of, they also contact and talk with the library, because they're both entities are going to be applying for the same parking. And I think it would be important that we start treating this town as a whole, not just as one project here and then one project here. We need to see how all the projects work together.
Okay, thank you. Anyone else? Seeing none, I'll entertain a motion to adjourn.
So moved.
Second.
Moved by Councilor Camillo, seconded by Councilor Donahue. Any discussion? Hearing none, all those in favor signify by saying aye. Aye. Any opposed? We stand adjourned at 10 p.m. Thank you, everyone.